To Thomas.
And I'm Ishita Roy, and we'll be your hosts. We welcome you all to day 2 of Impact Failure Conclave 2022. It was very eventful yesterday, with a diverse group of people sharing their failure journeys and lending different perspectives on philanthropy, policy, and entrepreneurship. We were so happy to have over 600 registrations, and all our parallel sessions were booked out. Before we start the day, we would like to make a few housekeeping announcements. We request everyone to put their phones on silent. In your participant kit, you will find a notebook detailing the agenda and information on all speakers. We also have mementos in the form of artwork depicting impact failure and this year's theme, Beyond the Binary, Failures and Successes and Successes and Failure. We hope you like it. Should you need any help, please contact any of our colleagues. You can spot them wearing a red badge. They will also guide you to the venues. The restrooms are located on either side of the auditorium, and water is also stationed outside.
While we have some fantastic speakers with us today, we are hoping that the audience also gets an equal chance to contribute. We'll be using Slido to collect all your questions during the sessions for the moderators. Please log on to slido.com and enter the code 2602108, which will be displayed on the screen at all times to enter your questions. It also allows you to upvote questions asked by fellow participants to avoid repetition. We are using hashtags ImpactFailure2022 and IF2022 for our social media communication. Do tag us if you want to share your experiences. Please note, dear guests, if you require live translations of the sessions, please request at the help desk.
We have them available in Hindi and Kannada and English. Thank you. So starting with today's sessions, the last 2 years have brought out the criticality of public health and pointed out the blatant gaps in the sector. How can we build a more strong and resilient system, efficient and accessible till the last mile? Today's first session is on complexities and simplicities of public health and will be moderated by Ms. Rachita Mishra from SELCO Foundation.
Can we also have on stage Dr. Rajni Ved from Bill and Melinda Gates Foundation, Mr. Neeraj Jain from PATH, Mr. Nachiket Moore from the Banyan Academy of Leadership in Mental Health, and Dr. Rachna Jain, obstetrician and gynecologist. We invite you to stage your guests.
So good morning and a very, very warm welcome to all of you. I'd say again that we would want to hear questions from you as much as possible, and even if we had to start slightly late, I hope we're able to accommodate that. But even if not, we like to gather questions for sure so we can come back to it. So the code is on the screen now, and please do log in and share your questions there. So to start off, I think health has been on our minds since the past 2 years. We cannot deny it. It's something that all of us have been thinking about no matter which field we were in. So in that sense, this panel is extremely important because we all know that some of the biggest decisions are taken, or the biggest innovations that happen are in time of crisis. So hopefully this session will offer us to also kind of reflect our public health system in general a little bit, not just from a COVID perspective, but in general. And as we kind of move forward, we really learn from the rich experience that is there on this panel and move forward from there. To start off, I would pass on the mic to Neeraj, and whichever way you prefer, sir. And
too many pages. Hi, good morning. Great to see all of you. And I'm really glad that I got invited. Thanks, Harish, wherever you are. And I remember when I got the invite and I read it, I said, yeah, I'd love this idea. Then he said, it said, it's in person. And I said, that's even better. And I said, absolutely yes. And then as the list of people started coming in, I got a little worried. I've got my donor on the panel. I've got prospective donors out there. We have government in the room. I said, okay, now he wants me to confess in front of all these people about our failures and So that was getting a little worrying. But having said that, I think I reached out to my teams. I said, okay, let's talk about where we failed. And I got lots of pages of information. Mostly it was about government failure. They kept talking about how government didn't do this and government didn't do that. I say, hang on. This is not about government failure. We know that there are challenges in the government and that's why we have a job. Otherwise we wouldn't have a job. But since, we're talking about our failures, so let's talk about our failures. Having said that, I still got 9 pages for 8 minutes. So I'm going to try and rush through them. I think the challenge always is that we don't actually say what we really know or what we actually know about our failures or what we feel about our failures. And that's also because as a not-for-profit, and I think this was discussed yesterday also, funding is extremely important for us, partnership with government is extremely important for us. So we are constantly doing a peacock dance to make sure that everybody likes us and they believe that we can deliver. But having said that, there is a truth. It's a very competitive sector. And we normally talk about the truth only in closed rooms, unfortunately. Path has worked in innovation for 45 years, so vaccines, diagnostics, devices, and system innovation. So we are very, very used to failures. There are, out of 100 things that we do, 1 is a super hit, super success, 90 fail, and 9 are probably somewhere in the middle. So we do know what failure means very well. But I'll just jump straight to the topic that I want to talk about. Out of those lots of examples that came from my team, the one that really stood out for me was oxygen. Does everybody know there was an oxygen crisis in India during Delta wave? Can I see some hands here? Everybody, including people who lived in the Netherlands, right? So we all knew that there was a crisis of oxygen. And India responded. And I'm proud to say, in a way, that Path was right at the center of that response. At the peak of it, we had 400,000 new cases of COVID a day. We had 3,000 daily deaths also. And a lot of the challenge was an unavailability of oxygen. Path had been working in oxygen for many years, so we jumped in. Government started calling us. Our donors started calling us, partners started calling us, people who we never talked to before started calling us, people who never worked in health started calling us, and everybody wanted to get into oxygen. Everybody wanted to support oxygen. Government was, of course, also trying to respond to the crisis. Some things worked very well. There was, instant response. By the way, this challenge of the peak lasted only for about 6 weeks. So that was immediate response for those 6 weeks was reallocating industrial oxygen to medical. Those kind of things work, transporting quickly from one place to the other, etc. But what also happened was huge amount of infrastructure got created. Massive amount of infrastructure. We currently have about 4,000 oxygen plants. One plant costs about 1 crore of rupees. There are 4,000 oxygen plants now across India. Every district hospital has probably 2. Sub-district, we've got plants. There are plants lying all over the country. Most of them were functioning at some point or the other. We're very proud that those 4,000 plants went out there. Government was funding most of them. Donors were funding some. They also got operationalized, which was absolutely fantastic. So extremely proud, that's our sort of success. But the challenge is that today, as we stand here, about 80% of those plants are non-operational because there is no demand. You don't need that oxygen today. That was a crisis peak and we've planned for that peak, we've got it. The other challenge is that when the next crisis hits, by that time, are these plants still going to be operational? Are they going to have maintenance? Are they going to have support which will actually continue to make them useful? Just to give you some numbers, I talked about the plants, but also oxygen concentrators. There were about almost 3 lakh oxygen concentrators, 300,000 oxygen concentrators that came into the country. They've been spread all over the place. I can tell you from my experience, from my team's experience on the ground, again, 80% of them have never come out of the box. Because by the time these oxygen concentrators started coming in, the peak crisis was over, and we were really now thinking about what to do with them. So where we are today is thinking about how do we deal with this immediate crisis, this impending crisis. How are we going to make sure that these things are going to be actually operational beyond COVID? Are we going to have this equipment available as and when the next crisis hits for our regular health system? A lot of it is not even being, concentrators are great things to have at a small sub-health center, but they aren't being used. They can be used for pneumonia, for heart diseases, etc., but they aren't being used. So that's really our challenge. The bigger challenge is nobody's interested. Nobody's interested. The government is not interested. Crisis is over. Let's get on with something else. Donors are not interested in funding any more of that work. The system is not interested in talking about oxygen. We have crossed that bridge, is the sort of feeling. Our years, 10,000 crores have gone into this asset, and we've been part of it. So really, when we think about our failure was to be able to actually predict this, to actually think about what we're going to do after the crisis is over. But at that point, there was just this frenzy of putting all this equipment there, getting these started, etc. And somewhere we missed the boat on sustainability. We missed the boat on how these assets could be really useful going forward for the health system. Quickly, I know that time is tight and we have started a little late. I just want to talk about a few others. So oxygen is the big one for me. But talking about other failures, we have programs where we've run in the low resource settings in Mumbai. We ran a hypertension management program. The government wanted support on implementation. The donor wanted to do an RCT. And we were sort of struggling in between that. And I don't think we did a great job of it. And that program actually didn't really work very well. The challenge also is to think about, when we go in, we think about a specific problem in a very narrow way. But we need to think about the economics. And a lot of times the economics don't work. There are social determinants, there are behaviors, human behavior, which we don't think about. We don't think about whether the system can actually manage it. Like the operation and maintenance of oxygen now, the system is all struggling with it. People actually shipped, our diaspora was great. I don't know how much money they pumped in during the oxygen crisis. They shipped concentrators to every district across the country. And now those assets can't be found mostly. What we need really is some amount of authenticity. We need to be able to go back. We need to think about what possibly can we do around sustainability. And I think we are blindsided about a lot of these issues when we go into a program. And I'm blaming myself because, we run a program. So we focus on donor, immediate requirement, government. But actually there is something much larger there. There is something much more comprehensive there which is going to build sustainability, which is going to bring long-term thinking around it. And I think we also think that, we are really important, but actually we aren't. We're very, very small in this whole larger system, especially when it comes to technical assistance. Just coming to some products, I just want to quickly end with a couple of products. We helped develop something called PharmaJet Tropis, which is a needle-free vaccine delivery system. We developed this great product, doesn't hurt when you get a vaccine or any kind of an injection. Not been very successful. It's been, the largest challenge has been cost. The product is too expensive. You've got to make a different kind of a vial if you want to put it into that. So vaccine companies need to be, okay to do that. There's fear around contamination because you're using the same thing again and again, although it comes through a jet spray, so actually there is no contamination, but that's the worry. And that's 10 years old, great product, hasn't worked. Another one which I want to quickly mention, and this is on women empowerment. We developed a women's condom. Fantastic. Moved the decision from the man to the woman. 10 years ago, or 7, 8 years ago, this product came in. Has not been successful. It has just not been accepted. And two large issues, women just did not like the product. They did not, I mean, from a behavior perspective, they just didn't think that was good. And the second thing was it was expensive. And we haven't been able to bring the price down. We have another one which is actually just approved in the government system called Cyanopress, which came out of also the PATH system, which is an injectable contraceptive, self-injectable contraceptive, which can be used, which can keep you safe for about 3 months. And very good product, been around for many years now, but very, very small in its reach. So those are some of the examples that I wanted to just quickly bring. I think I am sort of running out of time. Just to close, I think it's important to have these conversations, and Harish, thank you for this. It's important to have them more regularly than once in 3 years, Harish. It's important to have them with the right stakeholders. They're all in the room today, so that's fantastic. Congratulations to you, Harish. I don't know what the repercussions are going to be for me after this, but that's fine, Harish. I'll take that as it comes. But we should have more of these conversations. I think, like I said, I have 9 pages which came from all my teams as we dug deeper. And there are a lot of things we actually learned through this process as we were preparing for this conversation. So thank you so much. Thanks.
Thank you so much, Neeraj, for not only just sharing your failures, but also just extending this experience to the team as well. So we hope PATH takes it forward from here on, continuing to reflect. Many points that I feel all of us could relate to. And again, I think the great thing about this is that you're talking from a health sector, but I could relate it in the energy sector. And I know many of you would be able to relate the same in livelihood. So thank you, Neeraj. The next thing, the next 2 speakers, I think when we speak about health, like a common metric that we all use is MMR and IMR. And I think that is something that we use to kind of check progress, look at success of the public health infrastructure, the main thing that we all kind of work towards, or many of us in the sector work towards. And our next 2 speakers are going to share some learnings on that. So first I'll request Rachna ji to please share her experience, and then we'll have Rajni ma'am. Whichever way you prefer, ma'am. We'll have your presentation. And you have a clicker, ma'am.
Good morning, a very good morning to all. And I would like to thank the SELCO Foundation for this invite. And I hope I do some justice to it. And whatever I am presenting, it's not that I am blaming the government. I am also a part of this system. And whatever experience I have for the last 23 years that I have been working, I have tried to just bring it together. So I would like to start with a case scenario. A 22-year-old lady, Rani, who is an Adivasi woman who is pregnant for the first time. She has attended her 4 antenatal clinics at the local village health and nutrition day, and she goes to her neighboring health and wellness center, which is around 70 kilometers from the nearest hospital. She develops bleeding after delivery, which we also call as postpartum hemorrhage, and passes around 800 ml of blood. What do you think would happen to her? What will determine her survival? So this is what exactly I plan to discuss today. For myself, I would say I am an obstetrician and a gynecologist who has evolved and has been running a comprehensive primary healthcare center, and with a commitment towards the maternal well-being, maternal health being important. And this setup was situated in the rural parts of Chhattisgarh, and we have patients and women attending the clinics from more than 3,000 villages, which extend in the Adivasi belt of central India. But for now, present for the last 2 years, I am now working in the regional medical college in the Bilaspur in central India. So now working in these 2 different scenarios, where I first initially have worked in an NGO, and now because I am in a government setup and have also been a part of the rollout policy of the institutional delivery assurance paradigm, which was brought in because of the very high number of maternal deaths which were happening, and also deaths which are happening while women are trying to bring forth life into this world. So in the early 2000s, the maternal mortality rates were very high, and also because of some recommendations made by the WHO, we rolled out this program of the National Health Mission was started in around 2005, and this was followed by the Janani Suraksha Yojana, which were on its heels. And basically it was started with the aim of institutional delivery for all the pregnant women. We aiming for having institutional delivery for all the pregnant women. And one had to ensure it by having skilled manpower, good infrastructure, and adequate amount of supplies. And a conditional cash transfer of rupees 1400 was also offered, along with free to and free transportation to the institutions. My organization, where I worked for the last 2 decades, was also a certified facility for this ambitious national program, I would say. So as this program started, the Janani Suraksha Yojana, obviously, surely the numbers of the hospital deliveries increased. It was merely 18% in the beginning in around 2005, and over the next 12 to 13 years, it rose to almost 85%. The MMR also, the maternal mortality ratios also, which were as high as 300, they also went down to 115 almost in the next 12 to 13 years, almost in 2018, I would say. But then there are studies to show that this decrease was rather very slow, and it cannot be attributed to the Janani Suraksha Yojana alone. So this is basically, we are trying to show that the maternal mortality ratios also went down and the number of institutional deliveries increased. But there are some buts in this Janani Suraksha Yojana. I would say that in a hurry to increase the number of institutional deliveries to happen, and usually mostly they were being performed by the so-called skilled birth attendants. So one trivialized the interventions which were happening. One trivialized the interventions, and also one cut down on the quality of the program. In fact, I would say in my state itself, 25% of the deliveries were happening in the sub-health centers, being managed by a single auxiliary midwife nurse, and there is no physician available. There is no vehicle which is parked 24/7 in case any obstetric emergency arises, which requires an immediate referral to a tertiary center. There is no blood storage units for immediate requirement of blood, and neither there is any operative facilities available for such women. So I would, and the second thing is the number of deliveries which were happening on the way also increased because there was shortage of facility, there was shortage of transport. We did try to increase or upgrade the skills of the medical officers who were placed in these tertiary institutional birthing stations, but one tried to give them training for doing cesarean sections and also for giving life-saving anesthesia. But then again, one was not able to ensure its uptake, and as a result of which there was no decline in the MMR. In Chhattisgarh, I would say there are around 130 such peripheral FRUs, as we call them. But if you ask me, in only 1 or 2 of the FRUs, cesareans are done, and that too also electively only. It is no emergency cesarean sections are done. So one does realize that until and unless we ensure a concurrent improvements in the quality of the interventions, mere access to a birthing institution cannot help in bringing down the MMRs as expected, as we want, I would say. We need to become quality-centric. If we want that these institutional birthing stations should work, we have to define a minimum criteria for an institution to be for an institution to be called as a birthing station. One has to define a minimum criteria. And then after that, one has to make sure and seriously work on it and ensure that there is skilled human resources, there are good infrastructure, and there is a continuous supplies. Sorry. The next thing which I think is I feel, because I have been working in a rural area for a very long time, is that in a hurry, in an attempt to develop the institutional birthing programs, we decided to ostracize and we decided to discourage the role of the traditional birth attendants, or whom in the local language we call them as dais. If you ask me, if any rural woman who is pregnant and she goes into the labor in the midnight or at some odd hours, the dai is the only lady who is readily available at that time to help her out. But in this in the program of Janni Suraksha Yojana, we decided that we will not support them. I feel, if you ask me, that along with developing the institutional or the birthing stations, we could have also taken the help of these dais or the traditional birth attendants so that they could accompany the rural woman to the hospital. They could be a companion to them in the process of delivery and also of their help. And we could have used their skills in the postpartum period, which is equally important in bringing down the MMR. So I think by discouraging or by ridiculing them, it is a big failure on our part. We should have used their skills. A conditional cash transfer. If you see, why I call it conditional is because the woman has, a rural woman has to have a bank account, only then this small amount of 1400 rupees. There are studies to show that the actual amount of money which is spent in the process of childbirth is much more, even if the whole expenditure is being borne by the birthing center. Still, one needs more money for it, for transport, for any emergency expenditures. So by offering a meager amount of 1400, I would say that we are making fun of the poverty and dignity of a poor woman who comes to deliver and comes for support to these centers. These centers should have been fully equipped, and obviously the amount which is offered to such women should have been much larger than what it is given. So this, I think, is another failure of offering such a small amount to the women who deliver in these ill-equipped institutions, if you ask me. The Janani Suraksha Yojana, now we have put all the blame that we are not able to improve the quality parameters, and because of one is not able to do that, that is why the Janani Suraksha Yojana is not working well. But there is another parameter of JSY which is not often recognized or acknowledged, and that is of inequity. Inequity in the terms of the social, the economical, and the geographical determinants of the pregnant woman. As we can see from this, there are still 114 districts out of the total 640 districts which have an MMR of more than 220. And out of these 46 districts which have a very high MMR, they are situated in central India. This chart shows map is trying to show the distribution of the MMR, and as we can see, the central and the northeastern parts of our country still have a very high maternal mortality ratios. So I would say there is still inequity of this JSY program in terms of these determinants. So it is a failure if you ask. If a pregnant woman is poor, she lives in the rural areas, she belongs to a marginalized social group, or if she lives even in central or in the eastern parts of our country, there are high chances that she will die, as compared to a woman maybe like me who is urban, who is educated, who is not so poor and does not belong to an Adivasi or a rural family. So this program, JSY program, it has its successes because the MMR has gone down, but then it is not equal, it is not fair to all the pregnant women. It has its inequities. What needs to be done, which we strongly feel, is that one first has to acknowledge that there are so many determinants which are affecting the MMR, and also which includes the social, the geographical, as well as the economic conditions, and also the poorer districts. One has to acknowledge the poor quality of the interventions, and then one has to work strongly and focus more on the poorer districts, or the districts which are situated, which are marginalized and which have got a higher MMR. We have to focus more on those districts and then do it. Thank you.
Thank you so much, Rachna ji, for really kind of contextualizing a problem and how something can be perceived as a success or a failure based on several factors of geography, people, institutional capacity. Now I'd request Rajni ma'am to please have her presentation, where you also present another view, primarily giving us an insight again into MMR, IMR, and that aspect of health.
Thank you very much. Good morning, everybody. And a big thank you to the SELCO Foundation for inviting me to participate in this session. It's actually afforded me a little bit of luxury on reflecting on what it means to have a quote-unquote successful program to provide home-based newborn care to India's newborns, but identifying failures which may have deterred this successful program in reaching its true outcomes. So just for a little bit of orientation for those who are not perhaps from public health, is that newborn care in India or globally refers to newborn deaths or neonatal mortality is deaths that occurred within the first month of life. 2/5 of all deaths of children under 5 are in this period, and 75% of them are preventable. And home-based newborn care was a pilot initiated in, let me go on to the next one. ASHAs, by the way, are community health workers in India at the level of every 1,000 population in rural areas, roughly, normatively at least, and 2,500 in urban areas. We have over 1 million ASHAs in the country now. They were also introduced, and Rachna already talked to you about this National Rural Health Mission, which started in 2005. So India's ASHA program also began then. The story I'm going to narrate starts actually in 1993 with a pilot program that was implemented by an NGO called Search in Gadchiroli in Maharashtra, where they did a trial in 39 villages using community health workers to provide care for mothers and newborn in their homes. At that time in Gadchiroli, 95% of deliveries did occur at home, and so DIs were undertaking the deliveries, and these specially trained community health workers undertook newborn care. And I'll describe to you a little bit about the component of that intervention that was undertaken in Gadchiroli. They succeeded in a decadal period, in 10 years, bringing the neonatal mortality down from 62 to 25. They did a second stage pilot in Maharashtra with similar community-based organizations and demonstrated a 51% decline, even though they were not directly managing the program. Then from 2005 to 2009, They worked with the Ministries of Health and Family Welfare and the Ministry of Women and Child Development in 5 states in India, where there were 3 arms of a trial. In one arm, Anganwadi workers, who are in charge of the Integrated Child Development Scheme that looks after 0 to 6 children, were entrusted with the responsibility of newborn care. In one arm, community health workers, similar to what had been used in the original trial, were used, and in one arm, the system functioned as it did. And here we saw 25% reductions only in the arm where community health workers specially trained for newborn care were used. In 2011, because by then we had the ASHA and the National Health Program, home-based newborn care became a part of the National ASHA program, so to speak. Now, 3 rounds of the National Family Health Survey demonstrated. So in 2005, when NRHM was launched, the NMR in India was 44. In 2015-16, it came down to 30, and in the latest round of NFHS, it's about 25. Now, not all of these declines are attributable directly to the ASHA, unlike in the original pilot, where because there were very few other interventions other than high and very robust referral systems to a healthcare facility, very little of it was similar to the pilot. So my objective in the next few minutes is going to share with you the challenges of scaling up a pilot intervention from a well-run, well-managed NGO program in a few villages to a national program, and then having managed the introduction of the scaling up, how do you sustain the scaling up? And therein lie the failure lessons. So the situation of newborn care in India, and I thank Rachna for having covered some of this. NMR in India was 44. 60% of infant mortality was contributed to by these newborn deaths. The critical period in the life of a newborn is the first day, then the first week, and then the first month. At that time, we had very low rates of institutional delivery, and even where there were institutional deliveries, mothers and newborns came home in less than 24 hours, and therefore the care that could have been available to them in a facility was not available. And referral was often unobtainable. The realization that high proportion of newborn deaths are preventable, and reducing, and so the policy of the National Health Mission at that time included these following components, saying that NMR in high mortality settings with weak health systems, and many of the same states that Rachna showed you, could be undertaken with robust community outreach, the provision of home-based care, supporting mothers and caregivers to improve home care practices, and ensuring access to hospital-based care. Now, it just looks like 4 components, but extremely complex. Each one of these components is an extremely complex intervention. So this was the Gadchiroli pilot. They had women community health workers. They undertook modular training for antenatal delivery care, care of normal and sick newborn. These workers were trained for 31 days over a year's period and interspersed by learning on the field, so to speak. They undertook a series of home visits from birth to 6 weeks to the houses of the newborns, and because they belonged to the same villages where the newborns were, they could do this much more frequently beyond the necessitated series of prescribed home visits. Community health education, the workers of Gadchiroli were authorized to use injections and provide oral antibiotics as well as give injectable antibiotics, and they could use bag and mask for managing asphyxia, which is actually a very common cause of death in the newborn. There were fortnightly supervision, regular supplies given to the workers, performance-based payments, evaluation of knowledge and skills, and very robust on-the-job mentoring. This was undertaken in 39 villages. Moving to scale, when it was scaled up in the government health system, we had 1 million ASHAs at that time, 800,000, I think. The model had to be simplified. So we dropped the injection and the bag and mask component, although some states like Jharkhand opted to keep the bag and mask component, very wisely recognizing that because they did not have the facilities in place to take care of newborn care, perhaps the ASHA was the only recourse, and they had very high home deliveries at that time too. We reduced the number of training days. So this is a casualty of scale, if you like, the luxury of training. So we had 20 days covering a whole gamut of interventions to be delivered in a period of 1 year. And I can confidently say that many states, most states in fact, did not achieve this in 1 year. They took over 3 years, and we actually have some states who haven't yet completed that original 20 days of training. Then home-based newborn care was, of course, added to ASHA training. The ASHA was just meant to be a link worker. With the addition of this training, she actually got some skills in managing a newborn, added an equipment kit to the ASHA. And when I say this, I think some realization, and many of you work with governments, must consider what an enormous task it is to procure the equipment and make sure it reaches every ASHA in the village. So adding an equipment kit is just 4 words, but behind that lies a huge set of activities which includes procurement, costing, deliveries, logistics. It's a whole, especially to get to that last mile ASHA. Introduction of a supervisory cadre, and we're very grateful because it allowed us to advocate with the government to say, if you want the results that you saw in Gadchiroli, unless you have on-the-job mentoring by a facilitator who supports the ASHA, you're not going to get those results. We never did get them, but still. Collaboration with Search to sustain the spirit of the intervention and ensure fidelity to training. Again, a humongous task. Most state governments resisted the idea of sending their trainers all the way to Gadchiroli to be trained, but we insisted on it, and we were able to get this. And this made a huge difference to the way that at least the cadre of state trainers who were able to go back and train the next cadre of trainers in the field, because we do cascade training. And commensurately, there was also an expansion of newborn care corners, newborn units in healthcare facilities. This is needed. Not all newborns can be managed at home. Many of them do need referrals. Now, what were the major points of negotiation? I'm only talking about scaling from Gadchiroli to the National Health Program. We got a lot of pushback. Oh, how will we train so many ASHAs? We don't have the training infrastructure to do it. Our existing supervisory mechanisms are already overstretched, and therefore we said, well, then let's get in new supervisory cadres, and we were able to be successful in that. We got 1 facilitator for every 20 ASHAs. Orissa, Jharkhand all have 1 facilitator at the rate of 10 ASHAs, which is much better. There were concerns over creating new mechanisms for training, because we insisted on moving training to the sub-block levels so that ASHAs would be able to come. And we also insisted on residential training because it builds a sense of solidarity among community health workers to be trained together. There was a lot of pushback from doctors, of course. Professional privilege, you're handing over this equipment to the kit. Har ASHA ko doctor banaoge kya? This was a common refrain. We also had competing priorities. WHO, UNICEF had a model of integrated management of newborn and childhood management. Now that didn't entail so many skills, and therefore that model was being pushed, and there was this constant comparison about they're doing this and the government is proposing this, what do you really want? Civil society also pushed back. They said the role of the ASHA was an activist mobilizer. Now you're converting her into a care provider, and therefore you're going to give poor care to poor communities. It was another big challenge. And then we had this maternity entitlements for institutional delivery and 48-hour stay. And so people said, so why do you want newborn care? Anyway, the first day and first week are the tough ones. We'll take care of the first day by giving JSY to all mothers, and you heard from Rachna how that panned out. All right. So the lessons for scaling up, and some of it I've already covered, so I won't go beyond this. So, you know, we all talk about evidence-based scaling up. It actually extends much beyond evidence. We had the evidence. We had Gadchiroli that showed us 62% reduction. We had 25% reduction even in government-run community health worker programs to address newborn care. But it needed much more than that. It needs contestation, negotiation, and extensive consultations. And I've written here before and during adoption, I think it needs to continue for as long as the program sustains. It cannot end at any one point. Assessing system readiness, I think there was a bit of a hurry there, and there's always this trade-off, you know, is the system ready? Can we introduce this and then get the system ready? How do you decide? It depends on context. It's messy and iterative. Large-scale implementation implies quality loss. This is something we've seen over and over again, something that NGOs can pilot at scale in government. You must be prepared for quality loss, and then figure out how to address that quality loss. Balancing the pressures of quick scale up. Within 1 year of starting the program, how has neonatal mortality not reduced? We are investing so much in ASHA training, you haven't reduced neonatal mortality. Persistent advocacy, systematic scaling up. Now that was a lesson. Developing standardized protocols, modules, having training programs that were structured in place, criteria for selection of trainers, all that does go a long way towards scaling up a program. And then having an intermediary agency in place. Search was one intermediary agency, the National Health Systems Resource Center, and in the states, we had state health systems resource centers in many states that helped this partnership and knowledge management and sustained the program on the ground. My final slide. So we started the program in 2011. A decade later, what is the outcome of home-based? You saw the data. It's at 25. From 44 to 25 in a 17-year period, one might say and this varies across states. India has so much diversity, so it will vary, and Rachna showed you those maps. The same one would reflect same for neonatal mortality. There's widely varying coverage of home-based newborn care. In Chhattisgarh, for instance, which has a very robust ASHA program, 75% of ASHAs actually do the 6 visits that are mandated in the first 4 weeks. And therefore, but in Haryana, it's only 15%. In Uttar Pradesh, it's about 32%. 32% of ASHAs undertake 1 visit, not the entire 6 weeks, because they are paid an incentive for 3 visits out of the 6, because it became very onerous to track the visits, and at that time we didn't have technology. Maybe now it will get better. Coverage and quality linked to the support provided to the ASHA. That's why states like Odisha, Jharkhand, and Chhattisgarh do much better than UP, MP, and Bihar. There's an equation of the incentive disbursal. So at the national or the state level, they calculate the 250 rupees that's paid to every ASHA and divide it by the number of ASHAs and say, okay, this is the coverage of home-based newborn care, which is actually a terrible way of doing it. But because it's to say that we are covering so many newborns with home-based newborn care, but that's not the real truth. And that actually limits contextual investigation at the district and the sub-district levels, because everybody is so comfortable with the amounts being disbursed to the ASHA. And rightfully so, the ASHA deserves that money. Post-discharge follow-up notification. Now, as the expansion of facility-based newborn care increased, we had more babies going up to referral. But when they came back home, that notification to the ASHA that here's a sick baby that you sent or came from your village is coming back and still needs care is very, very low. And that is a huge missed opportunity. Whereas in a small setting, it's easy to do that. At the scale setting that we have in districts and sub-districts, it's difficult to do, and that's not happening. We have high institutional deliveries, but very weak intrapartum care quality, as Rachna pointed out. Limited training in organizing home visits. And this is linked to my last point about, since the program began in 2005 with about 4 tasks that the ASHA had, today the ASHA has over 40 tasks to perform. ASHA doesn't complain because most of her tasks are linked to incentives, and she is very well prepared since she is there in the village and says to us that I'm a 24-hour worker. But the fact is that the number of tasks she's asked to undertake have grown enormously. And therefore, she's asked to go to the same home to look for a person over 30 years who may have risk factors related to non-communicable diseases, to follow up on lymphatic filariasis, to follow up on leprosy or on active tuberculosis case finding, and newborn and maternal care. And this idea of organizing her day into a structured visit has not yet percolated, and I think that's an area for us to work on. And by the way, none of these failures are things that can't be worked on, and that's why I had them both in quote unquote. All right, thank you.
Thank you so much, Rajniji. And I think in a way, this is kind of signifying the title of this session, which is Simplicities and Complexities of Health or Public Health itself. Because you're thinking it's a very simple solution, but the scale of it, the institution behind it, the partners involved, the stakeholders involved, the capacity involved, it's not a simple issue at all. On our last speaker, I wanted to reflect a little bit more from a macro perspective. I think all of us here as development practitioners, one of the things we need to always strike a balance in is how do we cater to the needs today while making sure that it doesn't emerge as a need again in the future. We also almost always say that, as NGOs, the biggest indicator of us solving the problem is that we don't exist anymore. The civil society is not needed, either in its current form or as an entity itself. How do we really strike that balance for health? Where do the challenges lie? How do we go towards a factor that, or a world where going to the hospital is the last resort? If you could comment a little bit on that.
Yeah. No, I think it's a great question. Thank you very much for having me here. I'm somewhat of a poor fit in this August panel because I really don't have that much direct experience of public health. Most of my health work is new, and that's in curative health. I do work in public mental health now, but it's an early journey. So I'm grateful that I'm getting somewhat broader questions to respond to. Most of my work has been in the financial services arena. As Neeraj pointed out of 100 interventions, perhaps one succeeded, 99 were colossal failures. And indeed, I'm happy with the one, and that's something to be pleased about, but there were many, many things that didn't work out. But the benefit we have in finance is that in some ways, I mean, people could differ on this, and particularly now that this case is going on, the demonetization, it's not often a life and death matter. You can imagine a world. I chaired a committee for Reserve Bank of India when I was on their board on what the future of finance might look like, and then kind of work backwards from that to say, what should you do today that both helps today but works towards the future, even if sometimes you compromise the needs of today. In health, you don't have that luxury. You can imagine a world of the future, but people are living and dying today. And you can't say, well, I'll get to you later. Why don't we worry about the future and then, work towards that problem? And clearly that's a challenge. As a novice in this field, somebody that's just trying to understand what the opportunities and challenges are, my sense is the underlying thought still remains. As to, and I like working backwards rather than working forwards, and viewing today as a constraint against which you try to maximize. And to give you one specific example, I was in a workshop that, Path also sent somebody that was trying to look at can systems modeling, complex adaptive systems modeling, be used in health systems design. And an interesting issue came up in that conversation, that of time horizon. If we looked at 2025 or 2030, curative health was very important because you really needed to figure out many of the issues that were raised very nicely, babies delivered, babies dying, hospitals, this, that, and the other. But if you look 2050, curative health fell away in importance because really now we were talking about not so much when the system failed and you fell sick, what to do, how can we maximize the possibility that you don't fall sick in the first place? Just to give you a narrow example of something like this, in tuberculosis, we know, many of us in this room, about half the population has latent tuberculosis. And the key concern in the here and now is how do I treat somebody who's got tuberculosis? In part because I've got to take care of them, in part if I don't do it, they will develop multi-drug resistant tuberculosis, XDR TB, and it will become, a significant problem. But as I think longer, the question to ask is, how can I make sure latent TB doesn't turn into active TB? And that has got a lot to do with the building codes that cities are implementing to get ventilation. There is a very nice study that came out of Bombay that showed that these new buildings, that were built since 2007 of the Slum Rehabilitation Act, in places like Govandi, I don't know if you know Bombay at all, some of the remote slums, where slum areas were being cleared, they were being given housing so that high rises for middle income, upper income populations could be built. And the economics was working out very well, but the SRA buildings, as they were called, didn't follow a 100-year rule which gave people enough light and air. The study showed that the first floor TB burden in those buildings was 10 times higher than the TB burden on the 10th floor of the same building because of the changes in light and air availability by level. So as you think longer term, curative systems start to become far less important, and public health or social determinants, One Health, many of these issues that are becoming much more important now start to become far more salient.
I think one time we were having a discussion on livelihood, and there was a panelist who kept talking about health. The moderator was just like, what's happening? And she was like, health is livelihood, livelihood is health. Right? And I think that's what you were referring to as well. Like once you start looking at it from a curative perspective, it becomes much more cross-cutting. Because you're talking about building codes, you're talking about maybe the smoke that they're inhaling while they're actually cooking or actually in their livelihoods itself. Mental health is something that you had spoken about when we spoken about earlier as well. But I mean, silo thinking is very natural to all of us. And I'm saying as humans, as entities, that's how we are structured. But when the way that you're talking, it has to, we have to break that boundary. And again, it's not just for health, it's for livelihood as well. It's for other discussions that we've been having. Could you share with us some learnings that we can all take back on either how can we break that silo thinking, or if we are trying to design programs which converge programs and ideas and sectors together, what should we keep in mind? What are the points of failures? What are the weakest links in that sense?
I mean, obviously, if I knew answers to this, I would be standing in line for the Nobel Prize. But, indeed, these are complex questions, and I don't claim to have any very deep answers to this. The issue is very much there, though. For example, one of the areas in which I'm working in is urban health. Right? And we have the sense that pollution matters. Well, in an abstract sense, it does. But unfortunately, what you find with the evidence on the ground, clean stoves, you can't find the impact on respiratory disease. As pollution levels go up, you see the dose response. As pollution levels go down, you don't see it. If you see ambient air, we know that ambient air, many respiratory diseases come up. But unfortunately, the curve, once you cross the safety limit of PM 2.5, flattens. So what happens is that if you have very high PM 2.5 and you bring it down a little bit, it has no mortality impact. You have to really bring it to near zero in order to show mortality impact. A city like Delhi may say, well, we can't bring it to zero. Maybe then we should not try, because it's not an area of big attention. So that's kind of where things are not working. But there's other opportunities in which things could work. Bangalore, for example, emphasizes a lot green spaces. And people feel that's the right thing to do in order to give play, in order to give green lungs, as it were. But it turns out the evidence suggests that actually these things are a waste of money. The thing that produces the 30 minutes a day of active, what you need in terms of exercise, clean pavements in the city actually are far more effective at doing that than smaller areas that you have created elsewhere. There's hardly any utilization. My lived experience in living in Bangalore in the last 3 years is consistent with that. Most parks, most times during the day, are empty, which is great for me. I can do a jog without encountering anybody, but I don't know if it's such a good use. And even for green spaces, what you find is that the green streets are far more important than parks. And even for play, because parks require adults to come with you, often children don't go to the park. It's play streets nearby, near your home. In fact, as it turns out, the poor get a lot more play, the very rich get a lot more play. It's the middle income that don't get much play, because there's no space at all near their street, and they can't really get much activity. So you're quite right that we have to think across many of these. But the way I see it, I'm working on a new paper for, at the request of one of the government departments, on thinking about how does one organize for One Health, right? And the word One Health seems to suggest you bring everybody together, everybody needs to collaborate. So I looked at multiple country experiences as trying to set up these One Health structures, governance structures. Consistent failure. The coordination that we imagine should happen just does not happen. Right? And an economist in me is then looking for what we call separating hyperplanes, which is there a way we can use mechanisms, in some ways a middleware. In carbon, you've seen the price of carbon as an important, separating hyperplane, because now I don't need to coordinate. All I need to do is to measure how much carbon dioxide I'm producing and either pay or claim a subsidy. And the belief is that single price can make it work. What in One Health we are trying to do, in my paper, what I'm trying to suggest is maybe we may need to acknowledge to say that we need to think carefully as researchers and academics and propose to governments separating hyperplanes. For example, we know that urban areas, because of sewerage issues, you see a lot more diseases which are rickettsial and protozoal. Right? Maybe what we need to think about is not to burden Ministry of Health with all of One Health, but to say Ministry of Urban Affairs, municipalities, focus on protozoal and rickettsial diseases. Because that's what you can do. Rats and the ticks on the rats are the big issue. Focus on that. Right? Maybe coronavirus was a problem, but it's the travel industry that really transmitted it. But neither the railways, nor the airlines, nor commerce had any idea what to do. They do have health departments, but everybody was waiting for health ministry to say what to do. Right? maybe they are not well equipped to do that. Right? So one way to deal with coordination is to explicitly recognize that coordination is going to fail upfront, not imagine that there will be a coordination, and then design for that. So that you can think about not having coordination as not necessarily a problem, but a design problem around which you try to address it. You know, I don't know if this will work or not. Mine is an academic paper. It's not yet published, so the reviewers might reject it also. But you know, maybe there's something there.
We know now. Thank you so much, Nachiketan. Can we have a round of applause, please? So I really apologize. I have my eye on the clock, even as an organizer as well as a moderator. I know there are extremely interesting questions in Slido, and please reach out to any of our panelists, to follow up on these super interesting conversations. I feel like I don't have to summarize, but generally I feel like, when we, as I said, like a lot of the times when we speak, we say, livelihood is complex because crop changes from place to place, business models change place to place, market changes place to place. But health, it's one human body. So we can actually design systems very easily, and we can actually have, one disease, one medicine. But as we heard from everyone, it's not so easy because scale and the problem at scale has its own challenges as well. There are still complexities that we heard from our panelists, which were around economics of projects, social determinants being a barrier, the capacity of the system that not many of us account for, people's behavior, convergence of problems, but more importantly, stakeholders and ideologies, as well as, sometimes just us not having the larger sight in mind. So I think all of us, when we're designing programs, I don't know if any of us keep these points as in our minds at all, as factors that we need to consider, as Nachiket pointed out. So I hope as one takeaway, we're able to take that forward. And once again, a big round of applause, please, for the panelists here. Thank you so much to all of you.
Thank you, dear speakers, for a very informative discussion. Please accept a token of our appreciation. Can we have another round of applause, please?
Our next session for the day, taking cues from the last conversation, our next session for the day is actually on creating safety nets by breaking silos in the livelihood sector. This session will give a candid take on traditional trends in livelihood development programs and will aim to provide us with a reality check.
We have Ms. Yolanda Fonginkel from IKEA Foundation moderating this session with Mr. Surya Kumar PVS from NABARD, Ms. Malika Srivastava from Center for Microfinance, and Mr. Balakrishnan S. from Riti Livelihoods. Can we please have a round of applause for our esteemed speakers as we invite them on stage?
Good morning, everyone. For those of you that did not sneak out for coffee in between, there will be coffee after the session. So first of all, I would really like to thank SELCO Foundation for organizing this conference. It has been brutally honest. It has been a mirror for ourselves as well. Yesterday, we actually organized a session within IKEA Foundation Partners where we tried to design a livelihoods program, having designated roles for each and every one of us. And I mean, it showed the complexity of actually designing a program, let alone implementing a program like that. So really respect for all of you that are doing that hard work for us. I mean, we do realize what is happening on the back end. So having said that complexity, of course, there's a number of different stakeholders in the room. We have an excellent panel actually here that is representing a few of those. So I would like to introduce them first shortly, and then afterwards we'll actually listen to some more extensive presentations from all of them. So first, Mr. Surya Kumar. He has been the Deputy Managing Director of NABARD. Actually started at NABARD the year that I was born, we just found out, so has been around for quite a while, and serving different positions and actually working in 9 states. Then next up, we have Ms. Sriva Stava. Malika is fine, great, thank you so much. She's the Executive Director for the Center of Microfinance, and she has been for the last 7 years, and before that serving various positions as well. So, and then lastly we have Mr. Bala, and he is the CEO of Fruti. Actually has been starting with the organization since they started working with the first farmer and now serving more than 100,000 farmers. So before we actually start listening to the real experts, as I would say in this panel, I would just like to make a confession, because I mean we're here, you know, to talk about honesty and all. So I've been promoting this conference since I heard about it in 2018, which is actually a bit strange because I wasn't even present myself. But I just really like the idea that we're open to speak about failures. So I hope I actually succeeded in showing up now. I'm a strong believer in candid and honest conversations, and I do realize that being on the chair of the funder, we really have to invite others in order to start that conversation as well. And only then we can work in trusted partnerships and actually achieve those meaningful impacts that we want to achieve for the people that we're working for. So yesterday, one of the things that was still stuck in my mind was something that Victoria said, that she said, like, officially I'm like allowed to feel 30%, but she doesn't feel like she's allowed to feel 30%. So I think, what does that mean, you know, being on the other side as well? How can we facilitate and enable that, and enable that environment as well, where partners that we work with feel comfortable of sharing also the things that might happen differently than we anticipated on. So our founder, Ingvar Kamprad, actually, yeah, you could almost, well, I don't think he would have been happy with that, calling him a fan of failures in that sense, but he used to say, only those that are sleeping don't make mistakes, right? So, and I think that's something that is embedded in our organization as well. We try to really challenge conventional ways of working, try to learn from that, but obviously we can't do it alone. We're part of an ecosystem together with all of you in this room. So we're learning as we go, and I think we can also confess that we have been super successful in failing ourselves along that way and learning from it. So working with partners that are our ears and eyes, trust is really the key in that. As Ms. Rohini said yesterday, you need to learn how to trust, and if you give trust, you get trust. And that's something that I will definitely take away home after this conference. And creating that safe space for an honest conversation, and I think SELCO Foundation has done a great job in actually facilitating that here. So I hope we can continue with that with the panel here as well today. So yeah, as I said, we have a number of experts here, and they will actually share their experience from the field. They come from different angles, but you will notice, and they actually have all a different topic to zoom in, but we'll see that it's all going to be interconnected in the end. So. Ms. Srivastava, please. Malika, you can start. Thank you. Yes.
Very good morning, everyone. Thank you, SELCO Foundation, for this opportunity to come to a very unique forum and talk about, and reflect on failure. So generally in conferences, people talk about best practices, case studies for scaling up, and maybe this is also an opportunity for us to see what has not worked, and at least we can reduce the cost of learning, as one of my colleagues call it. So the learning cycle cost can be reduced for everybody. So thank you so much. I will talk about one of our initiatives, the Center for Microfinance we took up. Yeah. So I'll briefly talk about what the initiative was, how it rolled out, and how do we as an organization define what our failure is, because here also multiple stakeholders had a different definition of whether this was a success or a failure. Then internally, the group of people who were closely involved from our organization, we reflected and also took stakeholder feedback as to how what we could have done better, and so that's how I'll share. Yeah. So the Center for Microfinance, basically, it was set up in 2007, and just before I start, I'll give you a background. So the microfinance sector, the world over, there are I think a lot of colleagues from other countries also. So I'll give a little bit background. So world over, the microfinance model, the private, channels where companies or trusts are lending and to people through various groups or on basis of mutual collateral is the model. But in India, we also, NABARD has been the pioneer, and later on the National Rural Livelihood Mission has taken it up. The self-help group model, which is basically women's SHGs formed into groups of 10 to 20 members. They also save money, they lend it among themselves, and then over a period of time, they also sustain themselves through that interest differential, and a lot of apex bodies have been formed, and it's a well-established model. So in India, it is a unique model, and when the Center for Microfinance was set up in 2007, at that time, the thinking started around 2005, and Rajasthan, which is the state where we work, was not doing well either on the MFI model or also on the SHG model. And there was a deliberation among many stakeholders, including donors, academicians, NABARD, the Women and Child Development Department, as to what needs to be done to catalyze this sector, especially because on women empowerment, on indicators of women, whether it's economic or social, Rajasthan doesn't do very well, and self-help group could be a very good mechanism to do that. So when we talk to various stakeholders, many had said that quality is an issue, the availability of data is an issue. The bankers said that if somebody can give us some comfort that the repayment is happening, because it is of course not lending directly to the say the women, but through an entity of which they are a member. So that's how when we started off, and we became technical partners to the government of Rajasthan for various projects. And our Tata Trust is one of our core founders, and we used to manage and monitor a lot of their field projects, which had a lot of best practices. So when in 2009-10 we got this opportunity to partner with the government as technical and knowledge support partner, we were very keen, and one of the mandates which we had was also to demonstrate something new which could actually take the sector forward. And therefore in the document etc. also enthusiastically we also put something of our role as technological innovation and that kind of stuff. So in 2009-10 when we started rolling this out, we came up with this idea that we will have an MIS which would actually not be only an MIS, which could also be an accounting software. See, this was not, now it's a very, tech-savvy world, but in 9-10, there were not any Android devices, and that internet had definitely started reaching. So thinking of this at that time, we actually felt that we were thinking ahead. So we started off on this development, and so in this project which was in Western Rajasthan, so there were around 6 blocks which were in very remote areas, and around 5,000 self-help groups covering some 51,000 women had to be covered. So this was basically the scale which was envisaged, and there was keen interest from within the organization, and we started, we were an NGO. And an important point was that we felt that, okay, we have the design, we can hire any technical vendor, and we should be able to develop that. So we did not actually understand that, a technical development and continuous technical development is required in any kind of MIS application. This was not the thought actually we had that time. So we started off, and then we named our software as SAK Darpan. It is a very beautiful name. Our founding member, Professor Vijay Shankar Vyas, had named one of the initiatives which we used to manage, SAK Se Vikas, which means SAK means credit and Vikas means development. So we tried to take a step forward that, this MIS would actually mirror the credibility of the SHGs, and it could be used by banks, it could be used as evidence on the quality of groups for bank linkage. At the same time, the promoters, whether it is NGOs or the government, would get data, and they could actually focus on quality rather than numbers. So this was our thought. So we started off. However, once we developed the software, due to some project related delays at the government contracting of FNGO, so it had to be shelved for around 2 years. So the development happened, but there was no actual rollout. So this was something which happened. In 2012, the NRLM program, which had quite a different design from this program, was launched, and there was a lot of focus of the state to align all the development programs which had this SHG component to the NRLM model. Now that is easier said than done. So when you present to Secretary RD and Secretary IT and all, they felt very enthusiastic about it and said that why not? Why can't we tweak it to the NRLM design, and why can't we actually do it across the state? Now, something which was actually designed for 5,000 SHGs, and here you are planning to form more than, say, 5 lakh SHGs over a period of 8 to 10 years, we felt that, okay, at an organization level, we actually did not think through it properly. We felt that, okay, it could be it's a good opportunity for us to take it, this is a good opportunity to scale it up. So that happened, but once you are changing the design, it is, and with each secretary, with each government official, there would be requests to actually add GIS, and how can we also track other government schemes through it. So number of requests started coming, and the vendor, we had a fallout with the vendor also, because obviously you cannot keep on changing the requirements, and as an NGOs, we did have limited budgets also to do that. So that's, and then due to internal problems, the vendor team actually managed. So this was basically the data used to be collected from SHGs and in the manual records, and a copy of it used to come to the block level units where they had a data entry operator to do that. And the loan repayment schedule could go back to the SHGs. That was the design, so that it could help in aiding in accounting. And then the data would also go to the state government, to the NGO partners for monitoring. So this was basically the design which we felt did not have any, which was pretty okay. So in 2014, now what happened when you try to roll it out with certain changes at the state level, obviously the bandwidth became an issue, and at the central level also there were many changes happening. So then we decided at the government also that, why should we actually use it? Why cannot we not have NIC to build it? So that happened, and finally we restricted it to the project for which it was originally envisaged. So the actual, training, data entry, everything happened for around 3 years, 2015 to 17. But when the project closed and it got merged with the NRLM, we were actually hoping that the software, because it was a lot of reports, lot of data tracking. You could also, not only like MFIs, you could track the aging of loans, but also loans taken by leaders, and also a lot of it could be tracked. And we really felt that anybody would find it as a useful tool for actually monitoring the quality of their programs. However, we did make our best efforts, but we could not actually convince the government, and other government basically was the major actually stakeholders, because we were not into an implementation role. Our role was basically of a technical and knowledge support provider. So finally it came to an end. Now when Okay. Yeah. So interestingly, from the point of view of the project, so this Western Rajasthan project was funded also by IFAD, and the project team was different from the government also. They highly praised it and it was considered to be a success. But eventually at the organization level, a thought which we had that it could actually be continued, it would be adopted on a larger scale, either by the government or the NGOs, actually did not happen. So for us, I think we really missed an opportunity in terms of designing and thinking through the design part of it. And broadly, when we started, dissecting our failure, we felt that one thing which actually went wrong was as to, we should have identified as to who for the sustainability of, an MI software and who would it finally be used by. So whether it was the government, whether it is the NGOs, or whether it is the cluster level federations which are being formed. So finally, who is bothered about quality? Who gets impacted more about when a quality of an SAG, when the repayments are not happening? So we felt that there were seemingly aligned objectives of the multiple stakeholders, but actually they were not. So the government was majorly concerned about outreach, about the fund flow. The NGOs who were associated with the project actually were struggling with the payment terms of the government, and they did not have a long-term horizon themselves. Many of them had come in from other locations to work, so they did not have much interested in continuing beyond the project. Another thing which happened was that finally from the government the reports had to come to NGOs, and from them it was supposed to go to the village organization and the cluster level federations, but that flow back of information never happened. And we, our whole of our energy went into dealing with the government and the NGOs and training their staff, but had we done enough, had we reached out enough in terms of starting early to go and maybe recruit a more number of people to deal directly with the federations. Now, here the federations were also formed in the last year. So, but at least the village organizations and all, if we could have helped them access that data and how to understand and make use of that data, that probably could have, eventually helped it sustain for long, and a good mechanism could have been developed. So in terms of our learnings, we do have a few learnings. One is that being, if you want to start being an NGO, something of a highly technical ground, you should either have in-house expertise to do that. You should hire technical people in-house, but don't depend on vendors, because if especially your reputation is at stake. The second part of it was that the program, the NRLM or the Empower was also itself evolving. So any MIS or anything should be introduced only when it has stabilized for a little bit of time. Otherwise, it only leads to chaos and it becomes a project activity. The data entry became a sort of an activity, and rather than actually seeing what the data is reflecting. Third, most importantly, is that we at some point when these objectives or some things of your other stakeholders, it's very difficult to say no to the government, especially when your reputation is at stake, that, okay, you are supposed to be a technical agency, but, have you done enough, and your software is not working properly. So it becomes difficult, but probably sometimes it is best to put your foot down and say that, no, this is not actually what will help the entire program. So we should also learn to say no. And finally, unless we have the final ownership of people for whom it is eventually intended for example, if we feel the SAGs would use the reports, if we feel the village organizations or the federations would use the reports, then constant dialogue and their ownership on the program is more important. So these were some of the learnings which I hope many of you might already have, and I think with this tech-driven approach coming across all the sectors, education, health and nutrition. In the previous health session, they talked about the public health system, but a number of ASHA, Anganwadi workers are entering data into 4 to 5 applications, and because we also work a little bit in these areas. So it has all become a data entry approach, but who is analyzing the data, and finally, is it reaching the final people for whose data we are collecting, and how they'll use it is something which needs to be questioned internally by all of us. So thank you very much. I hope I have not exceeded the time.
Thank you very much, Ms. Malika. And also thank you for the background of your organization and actually stressing the importance of reducing actually the cost of learning, right? So each and every stakeholder has their own views on what has been a success or what has been a failure. And I think in general we can all recognize, especially in tech solutions, if you start implementing a system in a project scope, there's different stakeholders and they all want something, and we start developing a system and it eventually becomes like this big monster, and then we need a new system because the system doesn't work anymore and serves our purposes. So and also really stressing who is it being used by, but also whose data are we collecting and how can they then access the information that is useful. So thank you very much for sharing that. Mr. Bala, we go over to you to share your experiences from Fruity.
Thank you. Good morning, everyone. Thank you, SELCO, for this opportunity to share the failures. I think it is for all of us to come out and share boldly what we have been doing, whether we can actually share it to everyone here, and then also learn from others to be successful in coming years. Yeah, I would like to talk about today, I think in the country, what do you call the producer collective, which has been now, we have been doing self-help groups in the past. Now, how do we build the producer organization can be a vehicle to make our farmers' income reality. I talk about what are some of the learnings from, what are the failures, and then what as organization actually, certain learnings from that experience. Yeah, just to give a brief about, Vritti is part of a Catalyst group. We are based out of Bangalore. We have been in this space for about 28 years. We work on various livelihood transformation model. Currently, we have about 3-4 models where one is working with farmers. Largely, it's about how do we work with small producers, making them 3 times more profitable. I think in the country, we are talking about doubling the farmer's income. But as boldly, we are looking at it, how do we make tripling the small producer income? The small producer, which we are looking at it, one farmers, the other one is about fisher folks. The third is about micro, small, and medium entrepreneurs. That's a target community with whom we are currently working. The farmers, about 130 lakhs farmers, which we are currently working with. Yeah, why actually we got into this program itself? One is all of us know that the agriculture, the rural community is largely depending on agriculture. Their livelihood depends on farming. Can we do something? Can we create some model? That's when I think Government of India, everybody is talking about the collectives were successful. I think there are cooperatives in the country, like sugar cooperatives, or we have seen the Amul, or we have seen every state we have cooperatives. Can we do something similar? That's when we also jumped in. Can we be part of this journey to create model around that? Where I think currently all of you know that there is a program which is cluster-based business organization. Through them, 10,000 farmers producer organization has been launched. Already there are, you can say it's about, in the paper, there are about 17,000 plus the already producer organization existing, and there are 10,000 more is going to come. Yeah, what was the intended outcome which we were actually planning, and the part of the program to align the goals? One is about, all of us know that how do we increase the farmer's income? And more, we had ambitiously, how do we increase tripling the farmer's income? Yeah, and at the same time also, can we reduce the cost? Can we also reduce the risk? Can we also reduce, improve the productivity? And can we build the resilience of the farmers? Yeah. How do we build the resilience? Through bundle of services, which is not the one-off service. Can we add bundle of services, which, because maybe I may not be having that service, but can I work with the ecosystem players to offer the bundle of services, which is categorized into 6C. I'm not going into the detail. And also the ecosystem, which as an organization alone cannot do better, but we need everybody to come together and integrate those services to our farmers. And also the vehicle is about vibrant, the community institutions on the ground, the village and the cluster level producer organization. That's a whole, the strategic intent we had when we joined this program. We had actually promoted across country to about 100 plus farmers producer organization. And we also nurtured, mentored as a technical organization, part of NABARD and part of Small Farmers Agribusiness Consortium, and also the other CSR funding support. Where I think one is we need to also realize we jumped into it, but these are all institutions which we are building. It is for the lifetime, yeah? It's not a project basis. I think that's where the failure started. It is about time bound, and when you work on a time bound, you are more about delivering something, but not looking at what you wanted to achieve as a goal. Yeah, but I'm sharing it today here. It's not everything what we did failure, but I'm also talking about the failure within that what we have actually done. Yeah. Why we call it failure? I think the intended outcomes, which is basically why we are promoting farmers collective, which is we want to see that there is a sustained income for them. It is coming in. They are resilient. They are able to sustain and thrive themselves through their producer collective. I think that is the whole intent in which these institutions which we started, but we could not able to reach that milestone when we were in that journey. What we assumed, I think, one is that during this project time period, I think we'll be able to build that ownership among the community, which is possible. That's the assumption in which we jumped into it, but we miserably failed. Because we went into the territory where we have not actually worked in the past. Because there is a project. Can you come to this district? Can you come to that district? Can you go to this state? We went into across, but we don't have a connection with the community. But within this time frame, which you have to build that connection, understand community, build that engagement with them, build the trust with them, and it's an institution, but we have actually could not able to make it. That's where the assumption got the community ownership, which we could not able to build that. The second, I think this, we all organization as a maybe service-oriented charity, not into the business, because this producer collective are business entity. They have to make money. At the same time, make farmers realize that income. But as a team, I think we are not equipped from moving from service to the business approach. I think we could not able to also invest, build the capabilities of the team. We are not equipped that time. I think that's where we were actually not, like FPO promotion was a new venture around that time, no talent also available. Which is because we all know we work on community mobilization, we deliver service to the community, but running a business and understanding the business, understanding the risk, all that were actually challenged. That's where we could not able to build a team which can actually run the business. Yep, move on. And also, I think the part of the program is also the commitment is that the beyond project period, you will also render service to them continuously. The producer collective itself, it was not sustainable, and how they are going to pay my team cost to render continuously services. Then how long I can actually stay with them? Because I am not a donor, I don't have money. I can use what I have it in surplus, but how long that I have to convince my board as well. It's not possible. Yeah, but we lost money as well. We tried our best to, in this process, beyond the project period. But we could not able to make them to pay for the services. That's, I think, the capacities, because more we were into delivering the deliverables, which is you achieve 1,000 numbers, then you get paid, not on the intended outcomes. Yeah, that's where the challenge was. And also, we assumed the impact can be achieved in the 3 years time frame, but all of us knows that it is not possible. We know that SHGs, which we have been building, and still we are investing, how long? But these producer organization, which is also male, bringing them together and investing in 3 years, making that reality, it was a challenge. But we thought we can do it, but we didn't. Where fund dispersal connected to the deliverables, not to the intent and outcomes, then that's a challenge. And also, sorry, please, the transition, the conviction of our own team to run that business that I spoke. Yeah. What are the learnings? I think one which we realized, I think new geography, don't get into it. You don't know, it's a dark space. Once you understand, I think that's where all of us know it, but it's a program, it's a massive scale in the country. Why not we also do? And then we want to make that the intent to be reality. But in the journey, the learning is that new geography don't venture into. Where you have already existing, you are working with the community, then you layer this program. Then you can make it successful. Until unless you have not engaged with the community in the past, don't go and build this. Otherwise, you are abandoning like a children. Them, it's like abandoned children. They don't know where to go. Yeah, I'm creating a problem for them. It's just leaving out the institution building and coming out. That's a first one. The second is about, it's a more and more, it's a number game where it's a light touch model. It's just delivering the project. You are not looking at how do you create that impact. Then I think now we, as an organization, we said no. The current 10,000 programs, which I have not taken. As an organization, we have not taken. Because we said no. Many NABARD or SFAC team called us, why you have not applied for the CBBO program? You are one of the guys, you did well in the past. But we said no. Because a lot of learnings, we didn't take it up. Yeah. And also, I think it's a naturally how do we evolve these programs on the ground, not in the top to bottom approach, but it's required in the country to scale up the program. But at the same time, where you have already engaged, can you work closely with them, then you are able to naturally evolve these producer organization, then it is sustainable. Otherwise, it's not sustainable. That's a third learning. Yeah. And one more we found, I think it required a lot of investment to build the entire ecosystem and within the organization as well, which is to build the capabilities of the team. And as an organization, we are also ready to scale and support across country. And I think these required huge investment, not in the project itself, because the project, what we got, the money, it is not sufficient, but we didn't realize that, predict that so much investments are required. I think anything which we venture into new, I think we need organizations to be scale ready, and then also the capabilities needs to be built within the organization, and you need to have your monitoring, evaluation, all the systems in place, then you're able to support across country. Yeah, there are to name few failures where after the project, it was 1 year, these producer organizations were running, then after that, they wounded off. Yeah, maybe Surya Kumar ji should not ask me money back because, yeah. It is NABARD funded, wherein 3 in Vellore, which has got now post that, wounded off. That's a sad part of it, but we learned from that process. One is, I think, I spoke to many of the government officers. We all went to schools. I think not everyone get first mark or first rank, yeah, because these investments, but our money got stuck because of these failures, because it's not get released. I've written off in my books, but I've been talking to them. I sent to my son to school, he's not got first mark. Can I ask money back? Yeah, that's the status. Now I've been arguing with the IAS officers, can you give him money back? I have taught everyone in the same way, but I could not succeed in all the places. Yeah? Yeah, thank you so much.
Yes, thank you, Mr. Bala, for sharing so openly and candidly about some of the learnings within your livelihoods transformation model. And very recognizable, unfortunately, many of the things that you shared, that we shouldn't expect these long-term impacts to show up after 3 years already. I think we often take a local context for granted when we start building programs on it. So when we go into a new geography, we kind of forget that also needs to happen or needs to be in place in order to be successful. So super valuable. So thank you for learning a lot. I hear both of you that you should learn to say no to the government as well. And yeah, I think it will be very interesting. You already feel it coming, I think. So, Mr. Surya Kumar, can you please share a little bit of your insights from the policy side from NABARD?
Sure.
Thank you.
Namaskaram to all of you. Thank you, Harish, for having me here. Of course, Harish didn't give me an option. He only told me I have to come here 3 months back, and I'm here. Thank you for that. Here, I would like to present 3 points. I'm aware that there are friends from Africa and other countries here. That is the reason I want to present those 3 quick points. Then I will present one concept on which I'm going to talk, and then I'll present 3 failure stories what we are involved in. So we ourselves have lost money as an organization, so asking someone to get the money back doesn't arise at all. All of us sitting here, I think, are walking and talking soils. Do you agree with me? Maybe some of you very intelligent people can say, oh, my body is 70% water. Why am I walking soil? No, even the water comes from the soil, and water, like water comes from the soil and the food which we eat. So we are walking and talking soils. And when we're talking about development, when we're talking about development anywhere in the world, and especially in the developing world, we're talking with reference to people, we're talking with reference to the soil and everything around it, right? If some of you think you are not walking, talking soils, I think you should be some angels or something of that sort, and I will bow down to you. So another point which I want to tell is I work with an organization called as NABARD. NABARD is a development bank of the country. We basically supervise and regulate the rural financial organizations in the country. We fund state governments for creating rural infrastructure. We refinance the banks, and we work with all types of development organizations, civil society organizations. In a way, I can say, for those of you who come from other parts of the world, we're a World Bank type organization for the country. That's what we are. So here, since we're talking about development, I'm saying that I'm talking about a program where I'll share the experience from a program where we failed. And this is from around 2000 to 2007, three examples. There is a concept called as watershed development, which is widely used in the country. It is used all over the world. Basically, to put it very simple words, when rainwater falls in a particular place, it drains out into a particular point. So the concept is, if you hold at least 30-40% of the water which falls on the ground, for some point of time, the water seeps inside and a huge transformation takes in agriculture. When transformation takes in agriculture, so many things attendant to agriculture can happen. So this is the concept. In a watershed program, in each piece, we spend 10 to 20 million Indian rupees each project. Over a period of time, we have invested money in 2.5 million hectares in the country and spent almost 45 billion rupees in the program. So I'm talking about failures from this. Some time back, as I said, this dates from 2000 to 2007, these 3 stories. Once we got a phone call from one of the project site where we invested almost 15 million rupees. It is in the last stages of the project, that the villagers have completely removed all the engineering structures, they cut all the trees, and then they told the NGO who was implementing the project, don't come to our village. So, having spent so much time, effort, we wanted to go and find out what exactly has happened. They said, you can't come to our place. Then after a lot of protracted negotiations, we said, okay, we want to come and spend time in the village. They said, okay, come. So then 4 of us went. We spent 4 days in the village. They didn't allow us to stay beyond 5 o'clock. We used to be there at 9 o'clock, spend time till 5 o'clock in the evening. This is deep inside a place called Yavatmal in Maharashtra, this Maharashtra state. So we said, what went wrong when so many things are happening very nicely? Why did you ask us to get out? So no one was talking at all. No one was talking at all. Each one of us, separated. We were talking to everyone, whomsoever. We went to the school teacher, we went to the local officer, everyone. Finally, on the last day, on the fourth day evening, when we were asked to literally, now enough, get out. So one old lady said, hey, who are you? Who are you? I said, we came from Bombay, this man came from Aurangabad. We said, I'm asking, who are you? So then we didn't really get the hang of the thing. So she told, you're an outsider. How can you change the social order in our village? How dare you do it? I said, we have spent time 3.5 years. You don't know what the hell is happening. You are changing the social order. The person, the head of the village, also happens to be the moneylender, also happens to be the agri-input lender, and also happens to be the postmaster. The whole thing, they said, is getting completely vitiated and just get out. And that was the clear message. Then in that case, let me just get into the second one before I say something else. There is one, there is an organization which works with around 6,000 women farmers in one state. I'm talking about all these things, all these three examples are from Deccan Plateau. So they work with 6,000 women farmers. They do sustainable agriculture. Means great thing is each of these women farmer has 0.25 acres to 1 acre. Their lands are covered with crops almost 8 months in a year. They buy a bit of tea which they drink and a little bit of milk and salt and sugar. Nothing they buy for their homes. So this is an incredibly successful program. I was enamored by that. In fact, that happened to be my dissertation topic for my Masters in Sustainable Development, which I did in UK. So I was so enamored by this particular organization. I said, I want you, means there were 5,000 small emerald patches all over. I said, can I collate all these 5,000 patches into one 2,500 acre patch so that we can do a tipping point and say, hey, come on, can we not do sustainable agriculture like this? So we put money there, and 3 years, we went nowhere. And it caused a lot of problem for me to explain to my auditors why did I spend so much money and why nothing happened, why I abandoned the project. The answer is simple. Here the learning is, a person can be convinced. I can hold a person, I convince a person and bring the person once in a year saying that we are a particular group of people doing something good. But then when we want to collate that, it just didn't really work. Because these people, in fact, we told all these 5,000 people, we want you to be the trainers in your neighboring village where we can do 2,500 acres of such thing. It didn't really work. Third, there is a village 400 kilometers from where we are sitting. It's a 600 acre village. It has done stupendously well on its own. There is a word equivalent in the local language, it's black forest. It's not the black forest of Germany. It's almost black because they grow crops which are suitable. It's a small picturesque valley and mountains, and they grow some suitable crops. They have tree-based farming, which is very, very sustainable. So again, I fell for that great thing which has happened. I told the people in the village and the organization which has done this, hey, come on, since you people have done so well, means they budget the amount of water which comes every year, and they say that which crops, who has to grow based on where their farm is there in that village. So when I told them, you have done incredibly well, I want all of you to support this organization to create the same magic on 2,500 acres of land. Again, it didn't work. Say, like when we're talking about 5,000 patches of emerald into 2,500 acres, it didn't work. Here we have 600 acres of land where people have worked. They couldn't transfer this. Here the point is, as a development professional, what exactly we have to really do, I'll say this and stop. Since we're in a management school, the best management school in the country. Harvard Business School has converted a Korean tale into a management lesson. It says, it talks about, the Korean tale is from 3rd century AD. An emperor in South Korea once sent his son to a teacher, to a gurukul, to a college of learning or whatever we call these days, to learn so that he can become a worthy emperor. Every time this man goes after the training is over, he comes to the father and says, I have learned this. So father says, it's not good enough, go again. Finally, the father pushes the son. He says that to be a worthy emperor, you should be in a position to hear even the rustling of the grass which is growing. That means you should be part of the ecosystem, understand what is happening. Only then development happens. When you really look at these three examples, 3 failures, where we invested a huge amount of money, what is the point here is, as a development professional, do we really understand what is happening in that particular context? And what works? A small is beautiful is so apt here in these examples. So what works in one place need not work in other places. But the principles can be taken. But the most important point is, do we have the ear to the ground? That is the most important thing. If you don't hear the rustling of the grasses, you can't call yourself a good development professional. Thank you so much.
Yes, thank you so much, Mr. Surya Kumar. And yeah, I mean, we all agree we're here as development practitioners coming from different organizations, different stakeholders. And I've heard in each and every single panel that we do need to understand local context, listen to the people that we're working with, don't try to put certain models from top to down, take it for granted that things is replicatable. But I think a very important lesson from this is that we can learn from the principles, and those principles could be applied elsewhere. So thank you so much. We do have some time for some questions. I know that a lot of panels have been overrunning, but since we have 3 speakers, we do have that fortunate position. And I would like to kick off with one question that I saw on the Slido app, and then we take an opportunity to do perhaps 1-2 questions from the audience. So this question is actually from Sebastian, and I would like to start with you, Mr. Surya Kumar, and then perhaps both of you can reflect on his answer as well. So out of all these lessons, which one is the most critical to actually effectively change the system?
Which one of the lessons?
Of the lessons, out of all the lessons, which one is the most critical, if you can pick one to take away?
Ear to the ground. Ear to the ground, ear to the ground, ear to the ground, nothing else. Because what works in one village, in one state, need not work in another village in the same state. And I think all of us understand that there is a social order, social hierarchy. While some of us in India think, oh, caste system is the bane of the country, social hierarchy exists in all places in the world. You should be extremely aware of that, and here to the ground, nothing else. The very concept of scale is wrong. Absolutely. I say, for example, I think there are many. Again, we're sitting in a management school. There are many regional brands. Regional brands cannot become Lux soaps, which are sold all over the world, from Auckland to Alaska. No, they're not. Regional brands are regional brands. When we're talking about development, they have to be. You pick the best practices, but they need to be regional. Replication, scaling up, works up to a level and stops. As the manager funding it, you should be aware what is expandable, what is not expandable. These 3 examples, I tried. I put a huge amount of money. I ended up giving 1,000 explanations. Why did I spend so much money? When you spend 1.5 crore rupees, you end up giving a lot of explanations. I did. It doesn't work.
Thank you. Anything to add from your end?
Yeah, no, one, I think I agree with Mr. Suryakumarji is also, I think in my failure thing also I've given understanding the community is most important, which is, I think we want to be also aspiration to be scale, but in that process somewhere we underestimate the time it takes to understand and work with the community. I think that's one. The second also, as organization, are we ready to scale? And do we have a system? We are not able to predict, or we don't know how much it takes, how much efforts. I think we are not going into the details, nuances to when we want to scale. I think that's the biggest lesson we got from this. We created more problems than the solutions, because one itself we have not solved. Why do we take it into 100? Yeah. I think you need to have a scale-ready organization. You need to have your systems, back-end systems, everything should be ready. Then you are able to kind of support. Thank you.
If you excuse me, I'll say one not a very nice thing too. The arrogance of a development professional, that I am the giver. Don't get me wrong. The arrogance of a development professional or anyone, I am the giver, screws up everything.
Thank you. I think that might be a nice bridge to a next question. I see one there in the audience. Do we have a microphone to go there?
Good morning. My name is Paul Yilia from Sierra Leone. I am a technical advisor at the Energy Nexus Network. I also double as the National Energy Consultant for Sustainable Energy for All. I think we are hitting ourselves too hard in this room.
We have?
Yes, we are hitting ourselves too hard, like punching each other too hard. You know what? We are meant to fail. We have to fail, play, get up, learn, fail, get up, learn, because it is through failure that we succeed. Without failure, there is no growth. Already I see, even in the presentations, I see people giving solutions already to their failure. Like, maybe we should have focused on the impact, but we focus on the deliverables. Believe me, even if you had focused on the impact, you will still fail, because you are meant to fail. Why do we fail? Again, I don't want to go into that reasons and looking for solutions, because apart from the non-binary nature, we also live in an ecosystem that is not linear. Things are not linear. It's complicated. So many elements. We talk about finance for entrepreneurs, finance for end users, backward and forward linkages, technology, innovation. This is a complex ecosystem. So many things in there, policy, regulation, all of this combined. Tell me, who is so intelligent here among us to say, I know all of this when I'm ready to operate, and I know how to deal with all of them, and I won't fail? No. Nobody. Nobody. So let's accept failure. We are meant to fail so we can succeed. Thank you.
Thank you for your comment. Yeah.
He wants to speak, yeah.
Hello. Yes, thank you very much. My name is John. I'm coming from Tanzania in East Africa. I've been working in the government institutions and then again moved to public-private partnership organization, trying to bridge the gaps where these two parties has to work together. I'm really touched by the presentation by Mr. Suryakumar The lesson that you have shared with us is quite interesting, especially on the knowledge transfer between two different communities. Now, given the difference and the tradition of different communities, the issue of soil management, soil health management for our communities, for our farmers, who are actually the major component, the major portion of our population, and also doing a great role in our economies. How do we really work on addressing the issues of knowledge transfer? What you have just shared, it is practical in many parts of developing economies where agriculture is dominant. And the farmers, we will never do anything different in their production system, if at all there is no clear understanding about soil management. Production in agriculture starts from the soil. But this knowledge transfer has been in a challenge for quite long. We understand a number of projects in my country that where a farmer in village A has been adopting new approaches, technologies in improving soil health, but neighboring farmers for decades have never adopted anything. Projects from development partners has been coming, project from government institution has been coming in, but nothing is happening. How do we do about it? Could you share some experience from Indian farmers where you also noted the failure just you have mentioned? Thank you.
Hello.
There is.
Can I speak also? Then you can answer.
Yes, yes,
Satya.
yeah. Please.
Yeah, I'm Satya from Odisha. Thanks for your nice presentation. But my question is that actually, in spite of failure in watershed and what are the experience Surya Kumar ji was telling, we have seen 1,000 crores are spending on the MGNRGA, and all are giving employment to the rural people, as well as building lot of infrastructures on the livelihood. Can we make climate resilient livelihood structures? Because in spite of going into the study on this climate resilient aspect, all the structures are done, then after actually it is also there a huge devastation after the flood and everything is happening. So what is your suggestion? Because in spite of our a lot of the failure in watershed, why also repeating the same thing in spite of we are doing the climate resilient structure in the coming days also? Thank you.
I will try my best to do what from my experience. To John, the knowledge transfer, in my opinion, is possible when the people who have really done, who have walked the path, will come and transfer the knowledge up to a level. That is element which is very, very important. Someone who has really done will come and tell, this is the way it has to be done. 30 to 40% of the people still take it. I personally have done in one of my projects which I was running years back. I picked up a farmer who was running, who was so super successful in a method of cultivating rice without inundating with a lot of water, call it system of rice intensification. It came from I think somewhere in East Africa only. A Jesuit father has brought it to India. So I brought that person who was cultivating rice in that particular method and trained 40 people. Out of 40 people, 10 people adapted. And I ensured I paid money to the farmer to come every month. Only still 10% of the people done it. That is point number one, but that is the important thing. And the most important thing I believe for transfer of knowledge, a huge amount of audiovisual publicity has to be used. Somehow governments started believing there is no need for a huge amount of audiovisual push for transfer of the knowledge. I think that is really, really required. Earlier, when the Green Revolution took place in India, So there is something called the training and visit system, where the subject matter specialists went and sat with the farmer. After some time, we thought everything is taken care. And other countries in the Africa, you're also having this green revolution, which is being funded by several people. This is very crucial. Someone who has done it, number one. Number two, and a lot of audiovisual publicity. A credible source saying that it can even then only 30, 40, 50% of the people can take the transfer. It doesn't really work beyond a point. A lot of persuasion will only happen. When the tipping point comes, so many things happen. When the tipping point doesn't come, nothing happens. In Bangalore, near the international airport, all of you came from the airport, a kilometer to the airport, there is a farm which grows 1,500 species of plants, trees, including coffee, successfully. The agriculture university, which is just 1 kilometer to that, doesn't talk about it. Because the point is, see, the education system has developed based on some science. So if you adopt that, they think the science has become, they think they're rubbishing the science. No, it doesn't. Means it requires some guts to accept that I'm mistake. As I said, we failed, but this way we need to really learn. Then
I'm sorry,
time
I
is
would
up.
have to ask you to answer that other question one-on-one, and if anyone is interested into the answer, make sure to gather together, because I'm being asked to wrap up. I'm sorry. Yes. But it's a good sign that it actually triggers so much discussion, and it's such an important topic. And I mean, having the different stakeholders, having different roles, having different perspectives, but often in similar approaches, trying to achieve the same, it's really crucial. So I would really like to invite everyone to keep open-minded, have these honest and candid conversations, continue with an ongoing knowledge transfer in that sense. I mean, we don't need sessions for this, to talk about these things. So let's keep on doing this after the conclave as well. So I would like to ask for a big round of applause for the panel again. And thank you all for listening.
Thank you for an enthusiastic discussion, dear speakers. Please accept our token of gratitude.
Our next session is on shifting the gaze, the future of clean energy systems. It's time for a short hatti kapi break. Can we request everybody to be back at 12:10 sharp, please? We'd like to remind all our attendees that IIMB is a green campus, and please dispose all your cups in dustbins only. And there has been a request, can we not have any cups inside or any eatable inside the auditorium, please? Thank you.
the Gaze, the future of clean energy systems. This session promises to bring together perspectives from the field, academia, funding, and policy making in the energy sector. We are keen to learn how they inform each other's decision making and the implications of those decisions on the ground.
We welcome on stage moderator for this session, Ms. Huda Jafar from SELCO Foundation, along with Ms. Gauri Singh from IRENA, Ms. Stephanie Jones from Good Energies Foundation, and Dr. Jay Asundi from C-STEP. Can we have a round of applause, please?
Thank you so much, Ishita and Gitu. So welcome back, everyone. Very nice to have everyone back. I hope everyone's had their coffee and they're full. She mentioned aptly called shifting the gaze. I think we have been working a lot on how do we communicate systems and ecosystems and complexities better. And this was an outcome of that exercise where when we stop looking at our original gaze and when we shift it, then how does our vision sort of become broader and larger, and how are we able to plan and account more for failures much better, given that when you shift the gaze, your understanding is enhanced in many ways. The previous session this morning, I think they've been absolutely brilliant. Everyone would agree. I learned a lot. I rethought a lot of our own programs and projects, I think, just in the morning 2 sessions. So thank you so much for that. We did want to start this off by our own failures, but SELCO has had many failures over the years. Some of them are very well documented, some of them not so much. I did have a couple of slides, but in the interest of time, we're just going to focus on the panelists and the stories. But, we failed miserably on a clean cooking program and that was personally, I was involved in it, I drove it, followed all the participatory design, the processes, and it still didn't work out. I think most of them today are being used, they're rusted, they're used as umbrella stands and shoe stands and whatnot. Another program that we failed in is Light for Education, where we actually supported a lot of schools to have lights and children to carry pocket-sized batteries. And we learned a lot on ownership in public systems and accounting for operations and maintenance there, and how critical and the transaction cost of actually doing that. And the third is solar water pumps. I know that a lot of us working here have, solar water pumps. We've implemented so many in the past, and very often what ends up happening when you don't consider the soil, water, and the farmer is this will end up getting unused or underutilized one way or the other, because the water tables decrease further, and you've not really considered what happens 5 years, 10 years down the line, right? So here a lot of our learnings is how do you look at, solutions and program designs more holistically, bringing in the appropriate partnerships to account for or reduce the possibility and the level of failure that you could have, I guess. But as was said in the previous session, failure is inevitable. We cannot not fail. So with that, and coming into this session, I wanted to pass the mic on. And just to give a little context on the panel, the wonderful panel that we have here with the knowledge that they bring, we sort of have 3 different types of stakeholders here, right? So Gauriji, when she takes a decision and gets into a program and signs a document, it's literally a lot of lives at stake, livelihoods at stake, and it's huge decision making, right? So when you're in that position, like how much do you think about, will it fail? What will I do if it fails? Does it fail? You have Jay really representing C-STEP, but also representing, I think, researchers, academicians, and scientists, and what they bring to the table in terms of evidence building. And the recommendations that Jay gives Gauriji, how much of responsibility does the policy, do the researchers have on the kind of studies and research pieces that they take up, right? And you have Stephanie, who's really been supporting, every time I say last mile, she corrects me and says first mile. So you have Stephanie, who every time that she's been supporting first mile solutions, entrepreneurs, mostly on the decentralized renewable energy side. So we'll be hearing from all of these three perspectives, and hopefully all three will be weaving in and bringing in the end-use perspective as well. So with that, Gauriji, over to you for your experiences.
So first of all, thank you for having me here, because it's a clear recognition that I have a good failure pedigree. I was here in 2018 and I'm here again, so that's established. What I want to talk about is how working with communities over the years has really changed the way I think about implementation, and how I really failed to get that thinking across for so many reasons with many of my colleagues. And I think that's really, to me, a real personal failure. So I'd really be talking about that, but maybe position it in the context also of the decentralized renewable energy solutions, which, I think we speak about it a lot, but when you get into implementation, it doesn't really get us to the scale that we require to reach. So in Madhya Pradesh, I was looking after this program which we designed for poverty alleviation, working with communities. And every time I went into the field to talk to communities, I'd come back, feeling, oh my God, I know nothing really about how things happen and how decisions need to be made, or what communities are thinking. I'll just give you some examples. I went to this village where there's a group of women who are doing goatry, and I asked them, okay, these goats look different. They don't look the kind that you normally see. And they looked at me and they said, you know what? Whatever project we had given them money up front in their banks, and they said, you know what, we went 600 kilometers, went by train, we'd never traveled by train, went to this place called Magdoom in UP. We knew that the goats there were very good. We brought these Jamna Pari, and we know how to look after them. So, don't come and tell us why you're not doing these local goats, or why you're not doing, these kind of things. So we know what we have to do, okay? Then there's this village in Rajgarh, close to Rajasthan, and we were very happily greeted by this whole band group, and very nice instruments, very very posh instruments, and I was wondering how they managed to get it, and how did the procurement work. And they said, we went to Meerut, and we put our money in our, so they have this hidden pocket. And they said, we hid it there, went by bus in a huddle, and went and brought the best instruments back. And this is what we have. So community procurement, tells you a couple of things about how we think they should be doing their business, but they can tell you much more. And the third, which is a very important example, because I'll move to renewables now, is that there was a stop dam, a large stop dam that got built by the community. And when you ask them how did they actually get the engineering stuff done, they said, what do you guys think? Who do you people hire as mates? Our people. These are the guys your engineers hire as mates. They don't come every day. They come, once in a while, but it's these guys who do it. So we just asked this boy, who's been a mate to many of these structures from, the close by village, to come and guide us. And this is what we produced. So what I'm saying is that things that we think are rocket science, or, so complex, so difficult, we need to go and talk to communities to get a sense back about what the reality really is. So, after this whole experience and all the learning, I land up in a ministry which is probably one of the first ministries in the world or dedicated to renewable energy. Scientist ministry. I really didn't know what a scientific ministry is till I landed up there. And then I realized, oh my God, this is like a huge empire and these are gods of small schemes. Everyone was a god. Everyone was running these tiny, tiny schemes, bifurcated by, I think I counted something like 40. So one person is doing just a scheme on a particular type of biogas, spending, like 50 million or something in a year in terms of budget. Someone's doing commercial biogas and just focusing on that. And then creating this whole structure of a monopoly of being able to say that unless we direct it to the state entities who are similarly structured, only then it can go to the end user, because these are scientific things that we are doing. I'm not trying to disparage the whole science behind it, but it's just not rocket science. So you had these schemes, multiple schemes, which were all about, there was a benchmark cost, and then there was a capital subsidy that was being allocated. But the whole system of managing to get that capital cost was so complex that you might as well not have, even put it there, because no one was going to access it anyway. So I thought, this is my chance. Let me try and get this whole thing about community procurement, because what's like a biogas and even a solar panel, if you just go into some of the areas in villages in Bihar, you'll probably see them being sold like vegetables. So, really no great rocket science. But, I thought, okay, maybe, you can't do straight from the government of India, you can't straight go into community procurement, but maybe, let's at least democratize it, finish that monopoly that the state entities have, and get in many more players to do it. In solar, we could do it because, solar, luckily, there was a very strong mandate, political mandate, so, you could just push it through. So you had these channel partners who acted like aggregators to take it forward. But you still, I have to say that even despite knowing that, this is really not the way forward, we still have, and it's not just a case of renewable energy, but we still have this whole sense that we have to over-design because the people that we are designing it for are dumb, which is not the case. And then what we end up also doing is to basically say, because I'm the one who understands everything, the people who are the users understand nothing, you over-design and over-design. And instead of having one simple objective, we have so many multiple objectives that we are trying to fulfill that at the end we end up fulfilling nothing. So if schemes, and I hope there's no one sitting from MNRE, if schemes have not moved, it's really, the implementation is the whole problem, because I think the intent is good, obviously you want it to work, but it's also about not picking up the signals and not, as Mr. Surya Kumar said, having your ear to the ground. And at the end, I think it's also about the culture. The culture from which I come from is a culture of my baap. And that you've done, you've got into government, so now you can't be questioned, because whatever you're thinking is really the best way forward, and the people in front are your beneficiaries. So that whole sense is what gives us this multiple failures that we've seen in government schemes, because we're not talking as partners into doing our work, but as people who we are talking to are beneficiaries of a particular thing. So let me just stop here.
Thank you so much, Gauriji. I think everyone now knows what my baap means. But moving from large-scale ministry level DRE programs, subsidies, and some of the learnings there, Jay, I want to just move over to you. If you can give us a sense and focus on the rooftop solar bit that we were talking about. Thank you.
Thanks, Udo. I think I would rather stand because I need to see the slides as they come along. You'll have to move it to a different mode if possible. So as he's bringing up the slides, I'll just say one thing, that when I got the invitation, I was honored. At the same time, I was like, oh my God, everyone knows my failure. And then I thought that I can't say no to Harish because I didn't want to reveal to him how we are failing. Because what my biggest worry is, Harish would tell me that, Hari, I would have told you this long ago, right? And I think most of the SELCO people are laughing, and we know why. So this is something that, let's start with the fact that, we can go, I can go to the next slide. Oops, sorry. Yeah, so we know these numbers, right? That there's a huge renewable energy commitment. There's this announcement that we have achieved the solar mission for 100 gigawatts by 2022. We were supposed to achieve it, and they're saying we are achieving it. But we were thinking much longer term, and we were saying that, and this was around the time when we realized that this large solar parks are not the answer, simply because they add various kinds of externalities to this system. One is the load on the grid, the land availability, and then we also realized that distributed renewable energy was the way to go. But then as we were looking at it, the rooftop PV was not taking off. And there was a bit of a think here that what do we need to do to enhance the rooftop PV adoption, right? So I think there was some announcement just yesterday which talked about this last year there was a 1.2 gigawatts increase in rooftop PV across the entire country in the year, this calendar year. But we'll need to look at that. So, so land availability was a concern. We were also worried, and there was a scheme in Karnataka that told agriculturals that you can use your agricultural land for rooftop PV, and we were saying, okay, we are back to a food versus fuel debate. There was, of course, ecological issues, but when we defined it, so let's start with how we as an academic sort of, I would say pseudo-academic institution, we think very academically, we think problems and we try to identify it, but we are also engineers, so we also think of various ways in which we will fail. So failure is part of our DNA, to think about failure as we start off, but then of course, as Huda said it very rightly, we cannot not fail, right? We will find some other failure, let's figure out what that was. So when we defined the RTV problem, we realized there was one thing when we talked to people was that there was uncertainty in the payback that people were looking at. Now, there are people who will put a rooftop PV system irrespective of the payback, the financial payback. But then there's a large swath of people that will say, when am I going to get my money back? What is the payback looking like? And if it is more than 8 to 10 years, typically people will say, "Nahi yaar, not now, I will think about it later." So, and we saw the big uncertainty actually coming from people saying that, next door I have this building, the shadow falls on my roof, how much power will I generate, things like that. And so also the question was, I have enough space for a 10 kilowatt system, but should I put only 2, should I put 3? So that was the second question. And then of course, there's always a policy uncertainty, though we knew will always be there. That is whether net metering, gross metering, what is allowed, what is not allowed. And so there was a bit of lack of clarity. So at that point in time, we defined our problem. And I think this is something where I think that's our first failure, is that we define the problem the way we like to solve the problem, right? Don't tell us to do things that are real, but tell us to do things that we can do. And so that's how we defined the problem. We said let us think that RTPV will happen if the scale of operations is great, costs will come down, things will happen. So that is number one. Second is if I can accurately estimate what your roof, you as an individual homeowner, how much potential you have, and do some sort of a verifiable techno-economic analysis saying that if you put these panels in these places, you will generate so much energy. Given your consumption, this is how much you will make in your payback period. I think it's a fairly simple business case that you teach at any business school. And then we would then approach the discoms and assist them in creating this single window and do that, engage with citizens, make sure they all come and do that. So this was the way we thought about it. This technical solution, we said that if we have to do it at scale, we cannot sit and map house by house. It has to be done in one big swath. It has to be done very quickly because our urban areas are also changing. It needs to be done quickly and updated, of course. So we said we will do an aerial survey of large urban spaces, use high resolution imagery. So now this is where the academic side of us come. There was a paper in 2009, 2010 that said this can be done. Has anyone done it? No. So that's where our innovation comes in. We'll say we will do this. And we'll produce all this, so the rest all is all part of it, that we will create that. So what are the mapping technologies? There's satellite. It's very low cost, but unfortunately the resolution is too coarse, right? It's more than 30 centimeters. There was aerial photogrammetry, and at that time there was no drone policy. So we were not sure whether that would actually run. So what did we do instead? We mounted a lidar on a helicopter and flew it around Bangalore. And this just gives you a schematic of what was done. We flew it all around Bangalore, mapped every roof. We were able to get a lot of data. And this is what it looks like. I think let's just go through this. So this is just when you map it out, this is what it looks like. These look like houses, but they're actually what is called a point cloud. Each point at about a 5 centimeter resolution is being mapped. And what you do is you then stitch it all together, and you know the solar insolence, so you know how much sun is falling on every roof every hour of the day. Let me just go back a bit. And you connect all these point clouds and you can get a surface and you roughly know which building lies where, and as the sun moves 8760 hours, you know how the shadow from one building will fall on the other. And that was the essence of this particular exercise. And believe me, we thought we would fail on 2 counts here. The first failure we thought would be nobody will give us the money to do this. Luckily or unluckily for us, somebody came and said, this is a great idea, why don't you try it? And then we realized when we did the calculation that this is peanuts compared to what the potential was. And that's I mean, we are looking at almost, Bangalore has a potential of 2 gigawatts of rooftop potential. And even if we achieve 1/4 of that, the cost of flying would completely be met. And the second failure we thought was that we will not be given permissions to fly. Luckily, that was also solved. So as you know, suddenly we thought, boy, the 2 big problems we thought, we are done. We have made it, and little for us to know. So this is just to give you, many of you are aware of this building. All from Bangalore would probably know which building this is. And, we ran it for a whole bunch of buildings that we know are familiar. For those who are from Bangalore, you can still go onto a website called crest.cstep.in, and you can check for your own house if you have your RR number. So it's still running. And this is just to show you. And then we showed that for this particular building, which is Chaudhaya Memorial Hall, the place where music concerts are held, the payback period was within 3 years if you put rooftop panel, right? So we thought every house, people should be looking at this, and within no time, Bangalore is from IT city to solar city, right? So this is where we are today, sadly. And this is the failure I would want to talk about, is that with 1.4 gigawatt potential that we feel is easily doable, with fairly good rates of return, we expected about 1 gigawatt of installations. and the current installation is only 30 megawatts. And a lot of it has happened in the past. It's not, in the recent past, it's very low. So what is really happening here? And I think this is where I would like to, this is just a failure. And I think the piece that I would want to talk about is that the one biggest place that we have identified, and this is where we are still trying to do the post-mortem of this, is that we realize that the DISCOM is not the entity we go to at the end of all of this. It is someone that we have to actually engage right from the beginning because of the powers they hold as far as the distribution sector is concerned. And we have to work with them on two things. The first concern they have is that if you put rooftop PV, who is going to be the first entities that will take up rooftop PV are the people who are paying the most amount for their power. And that would mean their customers, the best customers are going to be going away. And so there is no incentive for them to do that. So the solution that we have found for that, and that's something that we are working on now, is that we are coming up with a set of people that we can combine commercial as well as individual households, which when combined together, you will be able to make sure that the average cost of power for the DISCOM remains the same. It doesn't get worse, it doesn't increase. And that is one way in which we have to assure them that this is going to happen. The second thing that is a little bit more technical is that if everybody in a particular street decides to put rooftop PV panel and they're connected to the same distribution transformer, then you will also have a problem. And that's where a technical analysis needs to be done. Unfortunately, our DISCOMs, and this is nothing to do with Bangalore, across the country do not know where your house is. If you tell them this is my RR number, they will have to call the lineman to saying, where is this house? And I think that is a big problem. And that is something that we are working on. So just to give you a sense of how we going forward from this failure is, one is working with the DISCOM to develop what we call as a data room, where they can identify the roofs that need to be solar panelized or get solar panels onto them so that two things don't happen. The technical considerations of the distribution transformers and costs don't go up, and the average cost of acquiring or buying power also doesn't go up. So these are the two areas I will say. So happy to hear more questions from people. Thank you.
Thank you, thanks a lot, Chair. So I'll go into questions right after this. Stephanie, over to you, if we can get your opening thoughts, and then we'll go into questions.
Thanks so much, Huda. Hi, everyone. Thanks so much for welcoming me here. It's great to be here. I think I'm falling forward because last time I was invited just as a guest, and now I'm up on stage. So we'll see which way I continue to fall. So Good Energies is a small family foundation based in Europe, and I run our clean energy program, as Huda mentioned, focused on energy access, primarily small-scale renewables for communities that are underserved by the current systems. So I want to talk about 3 failures that I've seen and been part of, because as a grant maker, when my grantees' work fails, then that's a failure within my program. So it might not be my fault. I hope it's not, but it's still my responsibility. So, and I think in some cases I have played a role. So sometimes we talk, there was a comment at the last session, we're talking about failures and then solutions right away. Well, we want to talk about failures so we can learn something from them and have that growth mindset. So the first off is in the framing of what we're even talking about. So we're talking about the future of energy systems here. So we're letting energy lead, right? So when we lead with energy, we end up with a solution like electricity connections. Every household in this country was deemed connected, right? Full electrification. My trustees come to me and say, so we don't need to work in India anymore, right? that might win you elections, but it doesn't solve the problems for the households that don't actually have electricity. So you can have electricity connections. Well, maybe then you have, connections with no electrons, but then there's no way to use the electrons if you do have the electrons. Okay, you've got the electrons, but maybe not all the time, and who knows how much it costs. Or maybe it's reliable and it's affordable and it's renewable, but only for 3 years, because that's when the O&M contract runs out for the developer and they pull out, and then we have another system that is rusting away. So how can we shift the gaze from leading with energy to, as Rohini sort of prompted us to, thinking about an energy-enabled system rather than an energy-led system? So if we change that perspective, we're going to start with the user. What do we want from the energy? Because it's not about the electrons, right? It's what you can do with it. And if we start from that place, you ask a very different question than what is the future energy system? Instead, we should ask, what is the future, what does the farmer's future life look like, right? A very different question. What does the future patient experience look like in a healthcare setting? So just switching that frame a little bit. The second failure that I've seen, and it's related to the first, is if we're going to start with the user, automatically we're going to pay attention to more than just the electricity technology. So Jay had a good example of sort of leading with a research project. This is going to lead to a perfect outcome. So we've seen people with their specialty leading with what they know and expecting that to come up with an outcome. I have a hammer, everything is a nail. Right? I know data, this is going to lead to perfect policy decision. I have a perfect policy, this is going to lead to perfect implementation. Or I'm a perfect community organizer, this is going to be the solution. But of course we need that ecosystem approach. Okay, I'm getting to the failure here. Even when we take an ecosystem approach, we find it's very rare that one organization does all of those things well, let alone one individual. Right? So in the decade that I've been doing this now, we've tried to push our partners to think more with this ecosystem approach. But if one organization can't do it, are there things that we as a funder can do to encourage collaboration between different organizations? We know we're part of that problem there when we make organizations and NGOs compete for limited funding, or compete with each other for limited funding, whether they're enterprises or NGOs. How can we change our processes to do less of that? And even when we encourage collaboration, it doesn't always work. Okay, so some of you might recognize yourselves in this story. I won't name names. But a few years ago, a number of us, including myself, but mostly folks here in India, sort of hatched an idea for a campaign to change the narrative around energy access. Right, there was this dichotomy between on-grid and off-grid electricity, and one was better than the others. And within the energy access field, we spent a lot of time arguing about, the solution is mini grids, or the solution is lanterns, or the solution is rooftop, or CNI is going to bring the market along, right? And we realized that actually this larger dichotomy, sort of false dichotomy of on-grid, off-grid, was not helpful. So, was there a way we could have an organized communications campaign of 5 or 6 different organizations, each bringing their specialty to the table? We provided seed funding, some other funders provided seed funding. There were going to be MOUs, and it was going to be very sort of mapped out, and it was going to be great. Well, it never went anywhere. The 2 or 3 organizations managed to raise funding. Some of the others didn't. It was actually a very sensitive topic to have organizations with foreign funding telling the Indian government how they should think about their energy planning. And maybe some of the organizations involved didn't have the trust of the other organizations. So it never actually led to any kind of campaign. But now we're 5 years later, and actually the narrative of energy access in India is completely different from where it was 8 years ago when I first visited India. There is a recognition that a lot of different solutions are needed based on the local context. For people with no electricity connections, the near-term solution might be lanterns. Hopefully they can graduate to a larger solution. The people with unreliable electricity from the grid might need a backup system or an inverter. So there's now this recognition of the need. And I think a lot of the conversations that we had in planning that campaign that never happened, people actually internalized some of the discussions. So the technical people brought their messaging, the folks that work on campaigns and movements brought their ideas to the table. So just in that planning of the campaign that never happened, we all learned a lot that we could take back into our work, even as we worked independently. Okay, very briefly so we can get on to discussion. The third failure I just want to mention is a failure of expectations. I think working with a lot of entrepreneurs in the energy access field, I've come to sort of take everything I hear, kind of like planning a house renovation or building a house. It's going to take twice as long and it's going to cost you twice as much. And every entrepreneur is incredibly optimistic about how much they can achieve and how quickly they can achieve it. And it's not my job to kill that optimism, but it's my responsibility within my program planning to recognize that this is actually going to take longer and build for that. And then, where possible, advise them to plan for the things that are unknown that are likely to make it take longer and therefore cost a little bit more. So managing our expectations that there are going to be complications along the way and that it will take longer and likely cost more. So those are 3 quick categories of failures to.
That's great. Thank you. Thank you so much, Stephanie. So from the multiple, I think, learnings from these failures within successes and successes within failures, but there's just maybe one question that I'll ask each and then open it out, and if we have time, maybe try and gather a couple of audience questions itself. But Gauriji, you mentioned the need to demystify clean energy systems, and it's come a long way and it's matured a lot. And you kept saying specifically, avoiding over-design. Is it possible for you to give us some example of either an over-designed program which we learned from and then moved to a more simpler, basic, something that's running well, and how do you, and I mean, the title of the session is Future of Clean Energy Systems, so the idea is how do we move towards a less complicated, but at the same time effectively designed clean energy programs.
All right, so Huda, all supply-driven programs are heading to failure because you really don't look at what the end users really want. So I'll give you an example. There are a lot of the primary health centers and district hospitals in Madhya Pradesh, for example, had experts come in who didn't talk to the people and the technicians and the physicians and whoever were the stakeholders of that particular ecosystem, and went ahead, put the solar panels on top, took out a room and filled it with battery, and they said, okay, this is now done. Now, at some field visit, when I went and visited, I said, okay, so you have this nice solar panel on your roof which gives you reliable electricity, and they said, but we never use it, and why don't you use it? So they said, we had a nice roof, these guys came and drilled these holes, now we have leaky roofs, so a lot of our infrastructure for health we can't use because one room they've put batteries in. Then we had this really good place where we would have patient consultations. We can't use it because the roof is now leaking. And anyway, none of us know how to do it. You have to call, if something goes wrong, you have to call someone from God knows where, and the guy never turns up. So, we're probably worse off than where we were. As compared to turning it on its head and saying, and I think that's the key, that this is not rocket science. It's ultimately the people who need to use it understand what their needs are, and they can find an expert to actually put in what they want. But the expert has to be someone who listens to them. So I think, again, it probably goes down to who procures the system and for what end. If it's a government entity that's doing large procurement and trying to run a supply-driven program, you're bound to fail. As against, putting it in the hands of the stakeholders who really know their needs and they want to use it and they want to make sure that it improves their working condition, and you design a program around it, then it succeeds. And there are many, many, many examples of this nature.
Thank you so much, Gauri-ji. Jay, coming to you, I caught on to this one thing that you said where, academics and researchers, you redefined the problem according to what was tackleable so that you could avoid failure at any cost. So if you can expand on that a little bit, and learning from that, what are you doing differently?
Yes, I think it's got to do with the fact that, the academic ecosystem is all about constantly showing that you're doing great and you're always succeeding. I think we all have been part of that, and it's particularly pathological in the academic system. If you've not, I know there's some professors here and they will look at me really badly in this, but this notion of if you're not publishing that one paper every year, why are you even here, right? Maybe at IMB it's 5 papers a year, and why are you even here? And I think we do not take on, and I mean this is my past life as an academic, is we never take on a project for which I know that I will be able to publish this paper by the end of the year. Otherwise, I'm out of there. So what do? We redefine the projects we take. So it's a very risk-averse approach. Now, I think sitting where we are as C-STEP, I think that's a rethink that we've had in the last couple of years, is that I think we should get out of that mindset that we need to have this very risk-averse approach. Let's go about taking risk-taking, because what do we have to lose? There's not much to lose there. Yes, maybe a few funders will tell us that, you guys failed, but given the funders I'm seeing here all accepting failure, I think maybe it's okay. So thanks, Harish, for educating me on that. But I think one of the things that we are doing is actually now, one is, of course, taking on a little more risk, saying that, okay, let's fail, it's okay. But also identifying the ecosystem approach, I think, that we are talking about. Now, how do we define that ecosystem so that we identify more people who will be part of the solution, rather than the academic way was always me versus them, or me versus the other person, and we are constantly competing. Oh, he put out 4 papers, oh, I have to put out 5 papers. That kind of thing. To saying that, if we have to get somewhere, we have to do it together. How do we find the right sets of people that will help mitigate those risks that I do not know? I mean, I think Rohini's talked about, right? Unknown unknowns, or those kinds of things. How do we mitigate those kinds of risks by getting different players, and then also accept that we might still fail? I think that is the other part. And so I think that ecosystem approach, taking on more people that we would normally not take on as partners in the work that we are doing. And I think that's the sort of the approach that we have. So now we are actually now changing our metric of success and impact. And we are trying to say that unless we scale what we are doing, we will not call it a success. It's still work in progress. And that is the approach we are taking.
If I can comment on that. Please. So Jay and I were talking yesterday, and that not talking about failure reminded me from academia of researchers who don't publish the negative results. So you test a new drug or something, and if there's no significant effect of that drug, it doesn't get published. But that's actually really important to know. And in our sector, it's also really important to know the things that don't work. And otherwise, we'll just keep repeating what each other's doing. So there's lessons to be learned also. I mean, it's not fixed in academia, but we need to fix it here as well. So we should publish case studies of what hasn't worked so that we can stop repeating those same approaches.
Yeah, absolutely. And as I understand it, you then shifted the success metric from getting a successful research done to actually getting adoption and scale from a research perspective. Stephanie, you also mentioned about curbing competition. You said, people were vying for a certain fund and, moving to collaboration. And I think in the last day and this morning, there was a lot of really strong points around collaboration, right? And somebody made a comment in the previous session, I think, saying that, let's plan and assume that collaboration won't happen. And then how do you do that? Rather than being, okay, it needs to happen, should happen, certain cases it won't happen. If you can talk a little bit, maybe with an example or not, but how do you do that better? Like, how have you tried to curb competition, push collaboration, or accept that collaboration doesn't happen? And a little bit on that.
Yeah, so I think like continuing to fund an organization even when their first project fails, if we had good learnings. I think in collaboration, continuing to, so that helps then with this. So if we have an organization or organizations that are working together and one of the partners in a collaboration, the thing that they bring to that collaboration fails to really add something, we don't just automatically cut our funding to that organization. We make sure we learn, and we try to, if we're going to exit from a collaboration, make sure we're being responsible in that and not leaving an organization in the lurch. Taking a multi-year approach and having agreement with the different players, so maybe there's 3 or 4 NGOs all working together on something, agreeing not so much on the activities or the specific, in the jargon of philanthropy, the deliverables or the reports or things, but what common goal are we trying to achieve that everybody is working together, and then leaving a lot of flexibility for the different players to figure out how they're going to contribute to that, and let it change along the way. That's really important. So making sure that my colleagues in our measurement and evaluation understand that what we're interested in is that ultimate change, and not whether they carried out all the studies they were going to carry out, or published the reports they were going to publish, or made so many connections, but have we achieved that end? So building that into our systems.
You know what Jay said is so interesting. I happened to look at the Indian Council of Agriculture Research, ICR, which is like the big body of working on agriculture research in India. And if you go through their objectives, they haven't mentioned the word farmer anywhere. It's so strange. So, and the whole incentive structure is for publishing papers. So they sit in these really fancy, large research complexes spread out over so many, hectares. And all that the scientists are really doing for getting promoted to the next level is doing research papers without any sense that whether that research paper is going to lead to any development on the ground in terms of productivity, because farmers don't even exist in and they've got their objectives almost like I think it's a copy and paste job of the Bhabha, the atomic energy department, and all of them have these cutting edge research and blah, 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 nothing of about how that research is going to help the person on the ground.
Thank you so much. So I have gone through the questions. I'm just going to ask one question because we're short of time, but I feel it's...
I have one request. Can I ask one question, please, from audience?
Sure. Yeah.
And particularly to Dr. Jai and...
we'll take two, one and then you and then.
Okay. Yeah, particularly to Dr. Jai and also to brought back a lot of old memories around research and publishing papers. Particularly being asked, what are you doing if you're not writing papers? So how do you think the whole academia, where we were being taught about all these successes, how you would success in about everything, starting from your basic studies or how do you walk and everything, how do you slowly change that narrative to, okay, this is how it need not have to be done, this is how it should be done, and how do you think in this scenario, you would sort of try to communicate and convince people that, you know, failures and knowing how the failures happened would also be important way for learning.
We'll just collect a few questions and then come back. So you had a question.
Because they are wonderful presentations. Clean energy is a necessity. Now there are great challenges and opportunities. And they have already said you have to be careful, there are hiccups. That's clear. Now the thing is, we should all overcome the hiccups and start to make it implement. As I said, it's not publishing papers. I was in IIT Delhi for 40 years. I know, I have been in academics. I know the whole game of things. Now, already one of this summary is we should go decentralized, off-grid. And it is possible because it is a dream that through grid we can supply electricity to every village in India. Today, villages, there are wires drawn to the village, but those wires don't carry current most of the time. Therefore, decentralized off-grid or microgrid mission must be a national mission. And it is doable, it is not rocket science. And we have the technology. Every village has solar and bio, every village. And there are a few with wind, small hydro, storage, and all the things. And it is doable and feasible. So the thing, we need to have an action plan, number one. Number two is, as Jay said, 1 gigawatt of potential in Bangalore, 30 megawatts available, only 3% is available. That means the gap is huge. Technology is available. Now, I think we also have to identify there is one problem in this: vested interests, lobby, mafia, whatever you may call. Ethics is a critical issue. You know, in all the things. And I think this session has been very educative, and it should lead to actions. That's all.
Thank you so much. No, I think just given in the interest of time. Yes. 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 Sure, absolutely. So I'll address that at the end. No, I did see that, but I think the conversation, okay, fine. Since it's really, okay, so this is a question that has, yes, go ahead, why don't you?
There is an allegation on the clean energy sector that it has a tendency to hide failures because of certain donors as well as investors' vested interest in promoting certain technologies. And it continues year after year despite no evidence of success of certain technologies. For example, microgrids. Economic success, business success is not yet visible, but we continue to pump millions of dollars behind such technology. It has happened in clean cooking, it has happened in biogas. Microgrid is the latest example of that, right? So are we saying that we will stop pursuing the basic business economics, which ultimately the people of this country want to consume and accept as a choice rather than something forced to them, right? And do we have that ivory tower position here, forcing solutions to people, even without proving that these are solutions?
May I?
Yes, Stephanie, go ahead. But I'm just going to move to final comments, just in the interest of time. But Stephanie, on specifically what Manoj was asking in microgrids, and then Jay, final comments with the research to action, and then Gauri ji with what end comments and reflections on what Sir was saying on action, and yeah.
I hear you. So I'm not going to comment on certain funders hiding negative results. It's definitely a problem. But I bring this back to one of the things I see, which is a failure in expectations. So we expect microgrids to be profitable when every other instance of electrification around the world has been subsidized. It was subsidized in the United States, it was subsidized across Europe. Why do we think that electrification in rural India can survive without subsidization? So asking every microgrid to be profitable in and of itself is the other problem, is even the programs often support individual microgrids rather than the portfolio of microgrids that a company might have. Because microgrids often might reach profitability after 4 years when there are enough appliances on board, but not in that initial stage. So you need to take that portfolio approach. But it comes back, I think, to expectations. But being more honest about what's not working, I think, is really important, because then donor or investors will also manage their expectations of what reasonable returns are.
So I'll kind of combine the question that also came was on this idea of, I think this is a society problem. It's not something that we can solve. I'm not here to tell the academic not to do papers. That's their job. That's what they have to do. I think the onus is on us who are outside of academia, though we are adjacent to them, to not take on their burdens on us. I think we should be thinking differently and in our own way and think of our metrics. And I think one of the metrics that we have started moving towards is this impact metric. And if we fail, so be it. I don't think, I'm also very clear that any person who is pedantic about the numbers will fail, because then you get only into the numbers and you have all kinds of bad behaviors. I think we should be very honest about that. And I think that's what, I think we have to start getting to an honest approach. That is, tell people that is not the only way to judge, or that's not the only way to measure success. I think one person's success could be another person's failure, maybe. We don't know. So I think that's that.
I think, it's also a mindset issue. The mindset issue being that who are the people who are managing our grids right now? They're people who, for them, 49 hertz is like it's like something that they can't shift from. And these are everyone who's actually who've learned about centralized systems. For them to now make the shift, so more than anything else, and I agree technology is there, I agree that there's also a way of looking at the schemes that have worked or not worked and get into implementation issues. But I think it's the mindset shift that we require to think differently, to think about solutions that are much more demand-driven and much more doable in the context of India, and not just try and look at something that's done very well. A rooftop, for me, I mean, I have my views about it, but it might have done extremely well in Germany, but it's not doing well here. So, what we need to do is to go back to the drawing book and really think, is this the way forward? Maybe it's not.
Thank you so much to all the panelists, and please feel free to approach them during lunch to actually get some of the questions not asked. I know there were some very important questions around O&M as well. My 3 key takeaways, I think, based on the learnings that really came out, I mean, apart from what was said in the previous panel, is, I think, the need for distributed, decentralized. I like the fact that the future clean energy systems needs to be locally procured, locally owned. I think that is really a disruptive way of thinking about it. We need future clean energy systems will embrace risk and think about it from a systems lens, and hopefully be collaborative and move towards stronger impact faster. Thank you so much. Thank you all. We have a round of applause for the panelists. Yeah.
Thank you again. Can we please present them with the mementos? Thank you so much. We are elated to have Mr. Per Higgins from SELCO Foundation amongst us. We look forward to learning from his rich experience of leading the foundation as a global, independent, strategic philanthropy with a focus on fighting climate change and improving livelihood opportunities for the poor. I invite Mr. Higgins and Ms. Huda on stage for a short conversation.
May I have a seat?
Getting close to each other.
So I'm really honored, and it's a pleasure to be part of this really special session. We did have a keynote planned, but I think because you were able to come, we sort of managed to really make sure that we can get in this session. So happy to welcome Per, who's the CEO of IKEA Foundation, with more than a decade of experience in philanthropy, being a leader in the development and climate space. We're really happy to have you. Thank you so much for coming, Per.
Thanks for having me. This is wonderful. I think I see more of my colleagues around this room today than I normally see in the office. So that's a really good start.
Okay, so thanks a lot. So I want to start off, Per, by you just got out from COP and you spent a while there. What are you most hopeful about? What's the hope coming out of COP?
I'll get to that in a moment, but before I do that, I really want to thank you, thank Harish, thank SELCO for putting this event together. It's just amazing to see so many people coming together and talking about really, really important issues in life. And the fact that you have put this conference together and actually you have the audacity to put the conference together with the subject of failure, I think is fantastic. And so far from my colleagues, I've heard, I just got in a few hours ago, but my colleagues told me that the attention to detail, the way you take care of every conference member here, it's just been fantastic. So I think we should give SELCO and the team a big applause for what they've done. Then to COP. In many ways, COP was really a huge disappointment. Disappointment because we didn't really make any progress on the key issue of cutting fossil fuels. Actually, we had to fight to actually get to stay on the Paris Agreement, which is not the way we're going to make progress in the years to come and actually make it possible to cut greenhouse gases by 50% in 8 years. So in that sense, this was a disappointment. There were some really good things happening too. We shouldn't forget that. So the fact that the world agreed to fund the loss and damage fund so that the people in the world who have the least responsibility for the impact of climate change but have really the most suffering from a result of the climate change actually get compensated in one way or another. Now, I realize this is a commitment to put a loss and damage fund in place, and that's basically what it is, and there's nothing more to it than right now. And my concern is that the commitment that the rich countries made in 2009 in Copenhagen to actually raise $100 billion a year to support the poorer countries in the world has never happened to that level. And I wonder if the loss and damage fund is going to have the same development. I hope not. I hope that we'll be able to see something very different. Now, let's talk about the hopes. I think what really gives me hope is partners like you, the partners we fund, and the huge progress that we're making together in driving for a positive development on the climate side. I think last year we launched in Glasgow the Global Energy Alliance for People and Planet, with an audacious goal on bringing access to renewable energy for 1 billion people in the world. We made some real progress in the last 12 months. We're operating in 12 countries, we have 26 programs running, and we're bringing together an alliance of all those who want to actually contribute, governments, civil society, foundations, business, to actually drive this forward and accelerate in a way that otherwise wouldn't be possible. That makes me hope. It makes me hope to see that the Science-Based Target Initiative that we started a few years ago is now having more than 3,000 companies committing to science-based target and basically committing to how they can maximize the effort they make as a company to reduce greenhouse gas emissions. makes me very happy to see that the methane hub is finally taken off. Methane, as you know, is a very potent greenhouse gas, and the methane hub is taking off, and there are multiple foundations and organizations coming together to actually drive a focus on reducing methane. So, but the final thing, and what makes me most positive is the interaction I have with young people, and the fact that young people have a different perspective. They are the victim of climate change. You know, I belong to the first generation that really felt the impact of climate change, and I'm also the last generation to do something about it. So I feel a huge responsibility for that. But young people encourages me to go faster, to do better. And I thought I'd mention an initiative that we did at COP, which was a real risky project. We actually teamed up with the UN. We created something called the UN Live. UN Live basically placed 27 containers around the world. In that container, you can actually, through technology, have a meeting with young people anywhere in the world. And I had discussions with young people in Africa, in India. We had one here in Bangalore, actually. And bringing young people's voice to the table, and those who are not at the table in COP, but need to be at the table. So we will use artificial intelligence, thanks to MIT in Boston, to actually capture the key messages and the trends and the concept, and we will share that. So this was a huge experiment, which is one other way of bringing young people to the table. So that makes me really optimistic.
Thank you. Thanks so much. I think that's really strong takeaways and hope for us as well. 3 or 4 very strong points there. I just want you to reflect a little bit on your journey. And till date, was there anything that you would consider as your biggest success, or IKEA Foundations for that matter? Like, what would you consider as a success?
Well, we've had a lot of successes, but it's not really us having the success, is our partners having the success, because all we do is provide money. Our partners actually do the job. So if we work with you and we build a long-term relationship to a SELCO Foundation because we believe SELCO can make a difference, it's SELCO making the difference. We're just providing the money. I think if I look at the journey over all these years, what we have learned that's really important is that development takes time. If you want to be part of driving a systems change, that takes a long time and requires a very extraordinary collaboration. And I heard a lot from the last panel about collaboration, about bringing different partners together, and most importantly, working with the people on the ground, and working with the young people, and working with the communities you're trying to help. Not try to sit in New York and London and Geneva and develop solutions that's going to work for those people. It's not going to work. And I think that one of the things we started very early in our foundation is to see wherever we work, how we together with our partners bring the people we're trying to help and empower to create a better life for themselves to be part of the solution. That's sort of what you do in business. I came from business, so in business that's an obvious thing. You talk to your customers and you understand your customers and you deliver against your customers' expectations. And I think that's where we made a journey from being in a foundation that provided great charitable funding to good causes to actually being a foundation that's focused on the 2 most important challenges to young people living in the global south, which is climate change and poverty. So that's the only thing we work on, climate change and poverty.
But why do you feel we should be talking about this more? Why do you feel we should be talking about failures, about dissecting successes, about learnings? Like, what is the criticality right now?
So, you know, we can spend hundreds of millions of dollars every year as a foundation because IKEA has been a very successful business. Right. The founder of IKEA sometimes came to meetings, he said, so what have been your latest failures? He believed so strongly in learning from failure that you learn so much better from failures than you learn from successes. And hiding failures was a sin in the IKEA organization, and it's still a sin. And it's a sin in our organization as well, because there's nothing better to learn from than the failures. And that means also that you need to have a good system around all your grant making to actually capture the learning from the grant making. So we put a lot of emphasis on making sure we have a strong and a robust system for monitoring and evaluation. We monitor to create evidence and to build our future investments on that evidence. If we don't have evidence available, we will probably take a lot of risk. And that's important because foundations should take risk. We are one of the few organizations that can actually take risk and fail. If we fail responsibly, it's okay. But we take risk and we drive learning out of that. So we put a lot of emphasis on trying to better understand what is the evidence available if we don't have evidence, what is the risk we're taking, and how do we make sure that we capture the learnings. And to capture the learnings, working with partners means that you need to have a partnership that is built on trust, on transparency, that we can talk together about what should be a course correction in the middle of a program because things are not, doesn't seem to work. As Stephanie would say, just don't cut the funding and go away, but actually work with the partners to see how can we do this differently and how can we learn from that. When we finalize a program and wonder where we're going to take it to the next level, that's one discussion. But equally important is that we invest in evaluating the success and the failures and evaluating the program and sharing those evaluations. So every year we will spend millions of dollars on specific evaluation, on evaluation done by a neutral third party that looks at what has worked and what has not worked, and make sure that anyone who's interested can learn from that, because we share that learning with everyone who's interested. When we're not in a competitive environment, we just want to create as much impact as possible for the money we have available, and if others can not make the same mistakes that we did, that's good, because we don't have to reinvent the wheel every time.
Right. No, absolutely. I think you couldn't agree more. Trust and transparency can get us sort of multi steps further. Before I get a couple of questions from the audience, so I'm going to ask a last question and then just open up a little bit for audience interaction. But in trying to do this, in trying to maintain trust, transparency, ensure that we're failing fast and forward and productively, what are some of the top lessons that you have learned in philanthropy as a leader? What are some of the top lessons in doing this better?
Well, it's really about how you build the partnerships and how you build partnerships for the long term, and how you build that partnership in a transparent and open way. And that takes time. Building relationships is not happening. Whether you and I build a relationship or we build a relationship with two organizations, that takes time. So you have to invest that time, personal time. And you can't do it on Teams, by the way. This doesn't work. So it requires you to go out and see people. And I think that's probably one of the key learnings. The second learning is you can't be successful without being very close to the field, close to the people that you're trying to help, and creating solutions with the beneficiaries, with the people who are the ones that you want to try to help to take themselves out of poverty. I also have learned something really important. I want to mention that so I have the chance before it's too late, okay? Because we have a situation in the world right now where we have an absolute existential threat, and that's climate change. And if we can't curb climate change and succeed in what we set out to do in the Paris Agreement, there won't be a livable planet for the next generations. Then everything else becomes secondary. And yet, 2%, less than 2% of philanthropy money today goes into climate change. Now that's a disgrace in one hand. But on the other side, you can say it's a huge opportunity, because there's 98% of philanthropy money that's spent somewhere else that should be spent on climate change. So we can actually be successful in curbing climate change and then focus on all the other areas. Because access to energy in rural India makes no difference if you can't live there.
Thank you so much, thank you for your responses. I'm going to open up a little bit and see if we have any audience questions. Oh, there are already some questions on Flux, but I see some hands up as well. There's one question that's already upvoted quite a bit, so maybe we start with that and then we can take some audience questions. So it says climate change or poverty are complex problems with many aspects causing them and many aspects affected by them. How do you ensure you see them in a system lens as a funder?
Well, when we focused on trying to provide energy to 1 billion people in the global south. We do that because we don't want the fossil fuel-driven energy to expand in this part of the world. You know, this part of the world makes up so little of the total greenhouse gas emissions in the world, but that's where the biggest growth is. So we need to ensure that that growth is happening in a clean way and not driven by fossil fuels. So it's preventing new emissions to happen, at the same time working to curb the emissions that we have. So that will have to happen in 2 different parts of the world, because where the emissions are and where the biggest opportunities are in Europe, North America, China, to some extent India, that's a different story compared to actually providing energy to the poor. If we can provide energy to the poor, that's going to be the biggest lever for economic development in that part of the world. And that's why we think that the combination of bringing, attacking climate change and bringing energy to the poor means that attacks the 2 key threats to children's future. The way we look at it is the climate change side and the ability to build a livelihood for yourself that make sure you can increase your income. And increasing your income, you will invest in your children's health and education, because that's what people do typically. And then we can drive development as in a parallel to curbing climate change, but it happens in 2 different places. And I don't think that it's fair to in any way curb the economic development in the global south, just because we have been doing what we've been doing in the Western world since the Industrial Revolution and put the world in a state where it's about to falter unless we do something drastically.
Right. Yeah. No, absolutely. There is also a question here that says that, IKEA championed modular design and do-it-yourself productization. Do these approaches have implications on how you've designed IKEA Foundation? I guess in general, what are some of the key philosophies or from IKEA, the business, that have made it their way into IKEA Foundation?
That's a great question. Who came up with that question? Yeah, great. I think the most important part that we have taken from IKEA to IKEA Foundation is a strong set of values that drives everything in IKEA. And IKEA is a company that is based on 10 base values, and if we had more time, I will talk about it, but I think one of the main values that I want to talk about now is a value called togetherness. We really believe in collaboration. We believe in bringing the parties around the table, have a transparent discussion, and make sure that everyone contributes and that everyone has a chance to contribute. So I think of everything we have done and taken with us from IKEA and learned from IKEA, it's really how we base our work on the same set of values, and that values underpin the decisions we are making. And in that sense, caring for people and planet is another value, and it's driving everything IKEA does, and it's certainly driving everything we do. And we are super concerned about the trajectory that we see now, and we're going to do everything we can as a foundation to not only invest in organizations like SELCO and others that are helping us curb climate change and bring energy to the poor, but also using our philanthropy money in a leveraged way. So meaning that if we can take our money to create that ecosystem that was discussed here, bringing in people who can create the ecosystem, and then bring the big investors in, such as the big development banks, for example, who sit on billions and billions of dollars but don't want to really take the risk. We can de-risk that, and that's what we're trying to do. So if we de-risk with our philanthropy funds, we can maybe achieve 10, 20, 30 times the amount of money going into installing renewable energy for those who have no access or very limited access to energy today.
Sure. There are quite a few questions here. I'm pretty sure people will be approaching you outside, but I'm just going to, if it's fine, I'll just go with the top questions here and not open it out to in person so we can save some time. Sorry? Yeah. Go. You were saying someone? Okay. So, One of the questions is also around your experience in sharing failures in a manner that is that is productive and informative, but not seen negatively by others. So the perception around failure, I'm not sure if that's a real perception or if that's easy to deal with within IKEA Foundation and with partners, but is there a way to curb the negative perception around failure that you've experienced?
Well, first I would say that what we're trying to do is not make this a perceptional failure, but have a robust monitoring, learning, and evaluation system around it, so we can agree that what's success and what's failure. But in order to have an open and transparent discussions about that, you have to have that relationship and trust. You need to understand from a funder's perspective and from a partner's perspective that it's okay to fail if you do it responsibly and if you work to adjust quickly. And that's why we have this system where we monitor all the 179 grants we have operating right now. We have three KPIs for each grant. And we have an ongoing reporting system that tells us whether we are on track to do what we need to do, or we have to make course corrections. But that's okay. Yeah. And that when we have partners we work with for a long time, they understand that this is the way we look at things, this is the way we'd like to optimize the impact of our investments, and you can only optimize the impact if you understand what works and what doesn't work, and you learn from your mistakes and learn from your failures. So I hope we can create, or we have created, an environment in our relationships to our 140 partners that this is okay to discuss, and it's okay to fail if you do it responsibly, even if you course correct on what you do. And that doesn't mean that we're not going to fund you in the future. That means that we have learned together and maybe can be even more effective in what we do in the future.
No, thank you so much, Per. I think that's super important, not only for other philanthropists and funders to learn from, but for, I think, even for practitioners and the sector and enterprises and NGOs to sort of, have that kind of, as Jay was also saying, that, okay, this is actually possible, that we can actually, fail together, learn, grow together, and it's not a, there need not be a negative connotation around it, which actually sort of prevents us from moving forward as society. I just want to thank you so much for being here, Per. I know that you've not had much rest even, and managed to make it for this event in time. So thank you so much. We will close there and move for lunch.
Thank you, sir, for your most valuable words. Please accept a small token of appreciation. For our next segment, we have 4 parallel sessions planned between 3 to 4:30 p.m. We have a fantastic roundtable of grassroots champions like farmers, community leaders, and frontline workers sharing their on-field experiences and failures in the system.
India Development Review is conducting a workshop on documenting failures. Failure Files, as it's called, has a cap of 20 participants, and we will be admitting people on a first-come, first-served basis. Please go to the registration desk to secure your spot.
A parallel session is dedicated to understanding failures in housing. This conversation would be discussing 4 walls and a roof and all that it takes to make a home.
Sustain Plus Energy Foundation and National Dairy Development Board will be discussing on learning from scaling biogas in rural ecosystems.
And lastly, we have Duane Foundation hosting a special session with their partners on creating an ecosystem for collaboration and failing forward. Please know that this is an invite-only session.
Another note is that these parallel sessions will be conducted in smaller classrooms. Please refer to your notebook, and our ushers can help you with the directions.
We request you all to kindly move on to MDC Woods, where we have arranged a lunch. We also have ushers who will help you. As a reminder, ushers are wearing red badges. We request all participants to gather back in the auditorium at 5 p.m. for the evening sessions, where we will be joined by Mr. Jaideep Verma, who will be sharing his failure story and moderating an evening of conversation and music with Swaratma. Thank you.